Okay.
Good morning, everybody. Thank you to our technical geniuses for again getting us online. I am Jeb Bradley, and I represent Senate District 3 and chair the Health and Human Services Committee. And today we will be holding a meeting of that committee. Before we get started, I'll read through a checklist to ensure that the meeting we are holding is in compliance with the right to know law. As chair of the Senate Health and Human Services Committee, I find that due to the state of emergency, excuse me, declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 and its extension, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that 1, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access to contemporaneously watch and or listen to the meeting on Zoom or YouTube and via phone by following the directions and links provided on the General Court website. 2, we have provided public notice of the necessary information for accessing the meeting in the Senate calendar. 3, we're providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remote Senate, that is remote Senate, all one word, at leg.state.nh.us, or you may call 603-271-6931. 4, in the event the public is unable to access the meeting, it will be adjourned and rescheduled. 5, please note that all votes taken during this meeting shall be done by roll call vote. And 6, finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please state also where you are and if anyone else is in the room with you during this meeting, because that is required under the right to know law. So I'll start by calling the roll. Senator Gray.
This is Senator Gray. I'm here at my home in Rochester, and I'm alone in this room.
Senator Gray, you may need to speak up a little bit more, but that's all right. Senator Sherman.
Senator Tom Sherman. I am in Rye at my home, and I am alone in the room.
Senator Whitley.
Good morning. This is Senator Whitley. I'm at my home in Hopkinton. I'm alone in the room, but my husband is in the house.
And Senator Avard.
This is Senator Avard, District 12. I'm here in my office in Nashua, New Hampshire. There are a couple people in the house, a couple of animals that are very vocal. Other than that, I'm alone.
And I'm Jeb Bradley. I'm in my office in Wolfboro and alone in the room. So having dispensed with the right to know script, let's open our first hearing, and I'll recognize Senator Sherman, who is the prime sponsor of Senate Bill 120.
Thank you, Senator Bradley. I am Senator, for the record, I'm Senator Tom Sherman. I am from District 24, which is 11 towns on the Seacoast. And I'm introducing Senate Bill 120 relative to physician assistant medical services through the Manchester VA Medical Center. As I think probably all of us know, the VA employs physicians from all over the country, and they rotate through their facilities. And as we also are likely aware, PAs or physician assistants work under the supervision of a physician. So the problem is that we may have physicians at the VA who do not have New Hampshire licenses, who are working at the VA itself, but they're actually supervising New Hampshire PAs. physician assistants. So this bill was brought to me, or this problem was brought to me by Linda Martino, who is a professor and a physician assistant in New Hampshire. And it addresses this issue in 328D2A by allowing New Hampshire physician assistants to be supervised by physicians who are not licensed in New Hampshire, but they must have a current license in good standing in their respective state. And that's it. And Linda, I believe, is here to testify to speak to any specific questions on this, but I'm happy to take any questions if you
Are
have.
there any questions of Senator Sherman? So I have one. Senator Sherman, I guess this is more, would you believe that your bill is an adjunct to a bill that I sponsored maybe 3 or 4 years ago after the flood at the VA to allow physicians to utilize their out-of-state license to practice in the VA during that flood. And this just extends that courtesy, if you will, to make sure we have an ample supply of physicians. That's a would you believe.
I would, and thank you for your work on that. That did sort of tee up this bill, which now allows those same physicians to oversee our PAs.
Are there any further questions of Senator Sherman? Okay, seeing none. Thank you very much. Kirsten, are you calling the attendees today?
I can do that, Senator.
All right, go ahead,
so-
Griffin.
Our first person signed up to speak is Linda Martino.
Good morning, Ms. Martino.
Good morning, Chairman Bradley. Thank you so much for the opportunity. And thank you all senators and especially Senator Sherman for helping us with this bill. My name is Linda Martino, and for the record, I am a board member of the New Hampshire Society of PAs and also a council member of the New Hampshire Medical Society, all three of which are in support of Senate Bill 120. I just wanted to mention those two things because hopefully you have also in queue, somebody can speak directly to this that's on the board of the New Hampshire Medical Society that is a veteran. And I just wanted to make mention, we have some students, PA students observing today, watching our legislators and advocacy at work. And thank you so much. And I'm going to allow my other colleagues to speak to the bill to keep this moving. Thank you so much.
Are there any questions of Ms. Martino? Seeing none. Thank you very much. Griffin.
Yep. Let's see. Next person we have signed up is Kevin Grady from the State Veterans Advisory Committee. Oh, sorry. Hold on.
Good morning, Mr. Grady.
Good morning, Senator. Thanks very much for the opportunity to speak today. For the record, my name is Kevin Grady, and I'm a 22-year resident of Hooksett, New Hampshire, after spending 25 years in our Air Force. And today I'm representing the 19 members of the State Veterans Advisory Committee. And we are chartered by state RSA to speak for the veteran community in New Hampshire. So one of the things that we do is we look at all the bills that are coming before the Senate and the House, and we pick out the ones that have veteran impact, and we vote on whether to support or oppose those bills, or just watch them and see what happens to them. We unanimously support this bill. We did reach out to Kevin Forrest at the Manchester VA and said that basically what we're doing is kind of cleaning up language for what is common practice at the VA, where you would have potentially a doctor who's licensed out of state who would be supervising a New Hampshire physician's assistant, or somebody, say in the earlier paragraphs in the bill, someone who has an out-of-state PA license and is seeking licensure in the state of New Hampshire. So both of those situations happen fairly routinely at the VA, and this language would just kind of clean all of that up to make sure that we're all in compliance with what we say in our statutes. So we support this bill wholeheartedly, sir, and that's all we wanted to say this morning.
Great. Thank you very much, Mr. Grady. Any questions? Seeing none. Is there anybody else, Griffin, or are we good to go?
Just a couple more. I have Stephen, Alex. I'm just going to bring Stephen in.
Good morning, sir.
Good morning. Thank you for your time. My name's Steve Alexikos. I am a resident of Dunbarton, New Hampshire. Today, I'm representing both myself and as the president of the New Hampshire Society of PAs, the NHSPA. I did provide a letter of support from the NHSPA, and I attempted to submit it to the email provided, and I got it sent back undelivered, so I apologize for that. But in summary, we identified this issue with the help of some VA PAs that were affected by it. We were lucky enough to have Senator Sherman sponsor the bill, and we just wanted to officially, on the record, lend our support to the bill, and we appreciate your consideration.
Great. Thank you very much, sir. Any questions? Seeing none. So we have two choices here. We can either hear the last testimony or we have 3 minutes to exec this bill. I think I know which way it'll go.
The only person I have left to sign up, Senator, is just signed up wishing to speak is Richard Laflamme. But as you said, if you want to go into exec session, I'll let him raise his hand and indicate whether or not he wants to testify. And I do not see his, oh, he has raised his hand.
Good morning, sir.
Good morning. I appreciate it. Very briefly, I appreciate everyone's support. My disclaimer, for the record, my name is Richard Laflamme. I'm a 23-year veteran of the Armed Forces and a current employee of the VA, and I would be a direct recipient of the cleanup of the language. And I appreciate this. I think New Hampshire has a large population of veterans, and anything that we can do to lure more staff members in to help meet the needs of those vets, I think is great. And for my department, this would streamline our practice and improve access to care. So I thank you for your leadership in supporting this, and I appreciate the ability to be heard. The views I express, however, are only those of my own, and I don't represent the VA or the military in this matter. Thank you very much.
Thank you, sir. Okay. Any questions? Yes. Senator Sherman, you're really trying to postpone the executive session.
No, I was going to do a motion to go into exec session, but
So I have to close the hearing first,
Okay.
which if there's nobody else to raise their hand, hopefully this will be the fastest executive session ever. Senator Sherman has moved to go into exec, seconded by Senator Avard. Senator Sherman,
ought to pass.
no,
Roll
we
call.
have to take the
Oh,
roll
yeah.
on exec session.
I'm trying to
Senator
go
Sherman.
quickly, Senator Bradley. Yes.
Senator Gray,
Yes.
Senator Avard,
Yes.
Senator Whitley,
Yes.
and I vote yes. Senator Sherman moves ought to pass. Is
Second.
it seconded? Seconded by Senator Avard. Senator Sherman,
Yes.
Senator Gray,
Yes.
Senator Avard,
Yes.
Senator Whitley.
Yes.
Is there a subsequent motion?
Consent.
Consent.
Senator Gray moves consent. Senator Sherman seconds. Senator Whitley,
Yes.
Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Sherman.
Yes.
Is there a motion to come out of executive
So
session?
moved.
Senator Gray moves, seconded by Senator Avard.
Who's taking the
Senator
bill out?
Whitley.
Oh, hold on.
I'm sorry, who's taking the bill out?
I'll take it out.
Okay. I'm done.
Senator Sherman will take it out. Motion is made to come out of exec session. Senator Whitley,
Yes.
Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Sherman.
Yes.
Bradley votes yes. And it's 8:45. Nice job.
Senator
Wow.
Bradley. Senator Bradley,
Yes.
I'm going to be disappearing to EDNA shortly, as
Okay.
we discussed. So
Okay.
I'll be back as soon as
Somebody
I
will
can.
introduce your bill. And as I told you before, if you're not back, I'll recess the hearing on your bill, which is 123, so that you can testify when you're back from EDNA. Okay?
Sounds great. Thank you very
But
much.
we will try to exec this morning too.
Okay.
Okay. Senator Avard?
I'm going to be following Senator Sherman in the DNA right after he testifies. I have a bill.
Okay, so what I would ask is stay in touch with me either by text or with Griffin by text so that we can make sure that we get an exec session in today. Okay?
I'll be multiple zooming on.
Multitasking. Okay. Well, that conversation took longer than the vote on Senator Sherman's bill. So amazingly, now I'm going to open the hearing on Senator Rosenwald's bill, Senate Bill 121, and we'll recognize the sponsor, Senator Rosenwald.
Thank you. Good morning, Mr. Chairman and members of the committee. For the record, I'm Senator Cindy Rosenwald from District 13, which includes 6 of the 9 wards in Nashua. And I'm pleased this morning to introduce to you Senate Bill 121. This is enabling legislation which could allow New Hampshire to exercise more local control, but also potentially save us some significant money. Following the passage of the Affordable Care Act in 2010, New Hampshire enacted a law to prohibit the state from using a state-based health benefit exchange, and instead mandated that we use the federal marketplace. And that's really worked out okay. But we do have to pay to use healthcare.gov for the maybe 50,000 or so people who purchase health insurance that way. We pay a 3% assessment per enrollee. And for this current year, that equals close to $10 million. But in the 11 years since the law was enacted, private businesses have developed market-based solutions for state health benefit exchanges. And this could be an option too for New Hampshire going forward that would give us a lot more data on who's signing up for what. And so we would have more control. Brokers and carriers could better serve the unique needs of Granite Staters. And it could also save us an estimate of up to $3 million every year versus paying to use healthcare.gov. So let me just say again, this is enabling legislation. It removes the prohibition on a state exchange, asks the insurance department to look at it, but it does not require us to move in that direction. So I think I'll stop there and I'm happy to take questions. There are also people who have technical knowledge about these products following me. Thank you.
Thank you, Senator Rosenwald. Are there questions? I just have one. Senator Rosenwald, the way this is written, that it has to have approval of the Joint Healthcare Reform Oversight Committee.
Correct.
What
So there's that other layer as well.
What would you think of potentially adding approval of the fiscal committee so that it, which you're on, I would note, so it touches more bases?
I wouldn't have an issue with that really. I mean, the fiscal committee is pretty busy, but since this does have a potentially positive financial impact for the state, I'm sure the fiscal committee would be happy for that. So I would consider that a friendly amendment.
Okay. Senator Whitley.
Thank you, Mr. Chair, and thank you, Senator Rosenwald, for taking my question. Do we, with a strictly sort of with the federal program, do we cede any control to the feds? I mean, will we get any more information, policy-based information that will help us in making policy-based decisions if we use a different type of product?
I think we would get better demographic information. So right now we get, or we can get, and the insurance department surely can get demographic information on who each carrier is serving on the exchange, their age, their previous insurance status, that sort of thing. But it's carrier by carrier. And we don't get it directly. If we did have one of these commercial products, I believe we would have better access to more granular information, but that's a great question to ask the representative from Get Insured, who's, I believe, signed up to testify.
Great, thank you, and will do.
Further questions of Senator Rosenwald? Okay, seeing none.
Thank you.
Griffin, do we have the insurance department?
Yes, I do. If you'd like, I can bring them in now, or I can hold them till later.
No, why don't you bring them in now?
All right. I have two people from the insurance department signed up, Tyler Brennan and DJ Betancourt, so I'll bring them both in.
Good morning, everybody. This is DJ Betancourt speaking on behalf of the department this morning. Could everybody hear me all right?
Yep, go ahead, DJ. Good morning.
Good morning. Thank you, Mr. Chairman, and good morning to members of the committee. My name is DJ Betancourt, and I have the pleasure of serving as the Deputy Commissioner of the New Hampshire Department of Insurance. In accordance with longstanding department policy, we are taking no position on Senate Bill 121 this morning, but rather wanted to share a few thoughts with you as you deliberate which direction you'd like to go with this bill. As you know, New Hampshire currently operates under a partnership with the federal government for the exchange in the individual market. While the department does approve product offerings, RSA 420N:7 currently prohibits a state-based exchange, as Senator Rosenwald mentioned a moment ago. As we understand the legislation, it would authorize the insurance department to examine the benefits of a state-based exchange and essentially bring forward a plan to implement one if, in our opinion, a state-based exchange would provide benefits to New Hampshire. The department, and I want to be very clear, will of course carry out whatever directive the legislature gives us. In terms of the research, I think the department would look at a couple of key areas, and I'll briefly share with you what some of those key areas would be. The first is to understand the issues around state liability, given that the federal government currently bears the responsibility of all of the issues and costs and potentially complications of the exchange. The second would be the steps necessary to ensure successful implementation, which includes the ability to procure services from one or more vendors, transfer data from the federal system onto a state-based system, and ensure that our new marketplace can share information with Medicaid and the Children's Health Insurance Program, otherwise known as CHIP, and as well as communicate with insurers and maintain enrollment of existing marketplace consumers without a hitch. The third issue would be to look at ensuring a better customer experience than they are currently getting on the federal exchange. This is important, of course, to ensure that more people are able to purchase the product of their choosing and the product that works best given their individual situations. Finally, there are, of course, objectives beyond technology and cost savings. And that, of course, is getting more Granite Staters insured, which is obviously a goal that we all share and that we will want to understand the impact on customer service experience to that dynamic, including identifying if we have large coverage holes, and if so, how a new state-based exchange could target those gaps. So getting back to costs for a moment, I would note that in my preparation for today's testimony, I came across the same information that Senator Rosenwald did, which is that the 2022 federally facilitated exchange user rate is going to 2.25% of premiums charged, down from 3.5% during the years 2014 to 19, and 3% in 2020 and 2021. So state-based exchanges on the federal platform, as we understand it, by contrast, would be 1.75% and a direct enrollment option down to 1.5%. So this would certainly be a consideration. There is one request that the department would bring forward today. As written, the bill asks that the Department of Insurance do the research and bring forward a recommendation, which essentially amounts to the department's opinion and a plan that would then be considered by the Joint Healthcare Oversight Committee. We would request that the opinion, or the recommendation, if you will, come from either that commission or the Commission on the Status of Health Coverage Markets for Individuals and Small Employers, or another legislatively established entity. The reason for this is that the offering of opinions on policy or policy judgments is not traditionally something the department has done. We are happy to do the research. We are happy to outline the considerations, the pros and the cons, but ultimately the decision on where those facts should take you, or whether or not to move forward toward a state-based exchange, should be in the hands of the legislature and similarly related policymakers. And so again, this is simply a matter of wanting to maintain the relationship that the department has enjoyed in the past of being the neutral fact gatherers and then leaving the decisions of policy to the elected branches. And so that would be my request this morning. And then again, just to highlight what I said earlier and what Representative Rosenwald had highlighted, as you move forward, do ensure that if this is a direction you want to go, that you address the issue of that prohibition that's contained in RSA, where is it? The RSA 20N:7. Thank you, Mr. Chairman. I'm happy to answer questions.
Are there questions of Commissioner Bettencourt? Senator Avard.
Thank you, Mr. Chair. Thank you, DJ, for your testimony. Just a couple questions. Basically, you mentioned about the state liability. Can you go into a little more detail on what the state liability would mean?
Sure, happy to do that, Senator. Thank you. So when I talk about state liability, it pertains to that customer service experience, the technical expertise, and whether or not we would lose any of the customer service experience benefits that the state currently gets by being on the federal exchange, and things of that nature. A big thing that I think all of us would want to ensure if the state were to go in this direction is you want to avoid some of the real challenges that states had when they first went to state-based exchanges. Now, we've come a long way since then. I think that a lot of lessons have been learned, a lot of mistakes have been corrected. But you want to make sure that that transition goes smoothly, because once you take on the state-based exchange, you own it at that point. And if you own it, you want to make sure that it goes well.
Follow up.
Senator Avard.
Thank you, Mr. Chair, and thank you, DJ. So you had mentioned about the department's opinion, and I'm wondering, is that similar to putting this into a study before we come up with a vote, yes or no, so that you could do some more research so that we don't make a rash decision and jump into something that we're not prepared for?
Well, thank you, Senator. And I think that the principle of what this bill is trying to accomplish, I think, is on target in the sense that it is asking the department to do the research. It is asking the department to look into the different issues. And I've detailed, I think, the starting place if the department were to be asked by the legislature to undertake this. Whether or not you wanted to have that study, that look at this come from a legislatively established entity, that's entirely your decision. But if you ask the department to do the work, we will absolutely do the work in as thorough and accurate a manner as humanly possible.
Further questions? Senator Whitley.
Thank you, Mr. Chair, and thank you for taking my question. So, as you indicated, this is just enabling statute to let, the department explore things. And I'm just thinking through the suggestion to let this go to the Health Reform Oversight Committee. So I'm not aware that committee meets very often. I don't know if the last time it met, or if you were aware of a bill that's seeking to repeal that committee.
Thank you, Senator Whitley. We are aware that there is some consideration as to whether or not that commission should continue. That's obviously going to be a decision that the legislature is going to make. I had simply offered that as one potential suggestion as to an entity that may be well positioned to help weigh in on whether or not this is a policy decision the state wants to make. During my previous life, I was in the governor's office, and a lot of issues pertaining to the individual market did come through that particular commission. What made me think of it. It was very instrumental, as I recall, in the decision to take Medicaid expansion out of the individual market and into managed care. That was a big deliberation. And so, and again, I just raised that because that may very well be a group that has some of that important background information and context to help ultimately make the recommendation as to whether or not this is an area that the state wants to go.
Further questions? So DJ, I have a couple. So when Senator Rosenwald testified, she outlined a potential savings of about $3 million that, if I understand your testimony correctly, is the difference between 2.25% and 1.75% of the premium charged on the two exchanges. Based on what you know now, is that an accurate amount of potential savings?
Yes, Senator, it is my understanding that that is approximately the number that would be saved and that that number is accurate. There are, of course, uncertainties around that. It would obviously have an impact on the type of vendor the state ultimately secured and what percentage of savings that vendor would ask for in order to run the program. And then there are, of course, a myriad of potential options to get some sort of matching donations from the federal government too. So again, those are going to be some issues that we're going to really want to dig into and get a better understanding of what additional opportunities may be out there.
And based on the department's assessment of the current state of federal versus state exchange, what other states are doing, has the experience of other states running their own exchange over that 10-year period of time become more user-friendly, easy to go, easy, as you said, to have that better customer experience?
That's a great question, Senator Bradley. I think the most accurate answer is that different states have had different experiences. Some came out of the gate and really stumbled. Others came out of the gate really firing on all cylinders. And so I think part of what the department would look at if we were asked to conduct this research is to give you some case studies of who did it right and why, and who struggled and why, and have those case studies inform you of exactly how New Hampshire should approach this. But as I said, we have come a long way since states first began implementing state-based exchanges. Mistakes have been corrected, lessons have been learned, and so I think it is certainly fair and accurate to say that most states are in better places today than they were when this first began. There are some other states who have recently gone to a state-based exchange. So we'll want to obviously see how they're doing it, given the benefit of hindsight that they now have.
Okay, so I guess my last question, this is more a procedural question. If the committee were to re-refer the bill, in other words, hold it over for, study through the summer and fall, would the department have the capability to come back and do that research without, a more formalized study committee, whatever, and make a report back to the Senate HHS committee that then this legislation could either go forward if a recommendation was positive or, decline to go that route. Would that be just a procedurally good way to handle this for the department?
We are happy to conduct whatever research you'd like us to conduct, Senator Bradley. And if that's under the auspice of this bill, we will do that. If it's under the auspice of providing you with information that will assist you in ultimately deciding what you would like to do with the bill, we will do that as well.
Okay. Senator Sherman.
Just a quick follow-up question to Senator Bradley's question, Commissioner. If we were to re-refer, if we were to go ahead with the bill, I guess which would get us to the finish line? If we're talking about cost savings to both policyholders and taxpayers, would a re-referral with a delay of probably over a year, since this would come back and then work its way through the legislature again, or since this is more of an enabling legislation, would it be more timely and therefore more cost saving if we were to go ahead and allow the department to do the look at this possibility as outlined in Senator Rosenwald's bill, and then we could move forward without delay?
Well, certainly you guys will have to make the determination as to whether or not the legislative process and the, I guess, delay of a decision on the underlying bill would be something that you would want to do or not want to do. But again, what I will say is the department will turn around the research and the report to you as quickly as we can, and then you can decide what you'd like to do with that information.
Further questions? Seeing none. Thank you very much.
Thank you, Senator.
Okay.
Thank you, members of the committee.
Yep. Maybe if you could just stay on if there are further questions at the end.
Absolutely. I'm all yours.
Thank you. Okay. Go ahead, Griffin.
Next person I have is Amit Dewan.
Good morning, sir.
Good morning, everyone. This is Amit Dewan from Get Insured. And Mr. Chairman and members of the committee, thank you for giving us the opportunity to testify. I just want to check can everyone hear me okay?
Yep, you're good.
Perfect. My name is Amit Dewan. I'm representing Get Insured in favor of the Senate Bill 121. We support this bill because we have seen the state exchange implementations have consistently benefited the consumers of the state. Due to various factors, I'll make some key points here. I think some of those have already been made in this discussion. But first and foremost, the state exchange provide more local control and more data. States can collect all of the data they want and make healthcare decisions and policies for their residents. And when I say all of the data, which means you'll have full control on all of the demographic data, enrollment data, the service area data. So you can find out about the service holes or which service areas you do not have coverage or only have single plan, etc. So states kind of look at that data and work with carriers to provide that service. Number two, state exchange provide much better user experience, particularly for the mixed households and those who churn between Medicaid and CHIP. As far as we understand, the FFM does not allow any flexibility across states, whereas your own state exchange, you'll have a lot of flexibility to up that user experience as well. Thirdly, FFM now charges an increased user fee of 3%. This user fee provides additional burdens to FFM states and contributes to higher premiums in FFM states. There was a study from Kaiser which shows that on an average, the premiums of states using FFM are about 21% higher than the states running their own exchanges. And that's due to a number of factors. User fee is not the only factor. I would like to make a point that technology has matured a lot since 2013. Setting up exchanges and transitioning from FFM is routine now. Get Insured has 4 state exchanges, which they've transitioned from FFM. The changes which have happened over the last few years is that the whole transitioning process has become pretty standard. CMS has invested heavily on making that process standard. Vendors like Get Insured have invested in following those standards and have seen basically in last couple of years, we've seen 3 exchanges making use of that standard transitioning process. Of course, technology will provide a better customer experience as well. And last but not the least, on the savings, means in our experience, states can save up to 50% of the FFM user fee transitioning to state exchange models. Of course, depends on number of factors as well as to which vendor you select. But I'm happy to take any questions.
Are there questions? Seeing none. Thank you very much.
Our next person signed up to speak, I believe, is Peter Bragdon.
Good morning.
Good morning, Senator Bradley, members of the committee. I'm sure you can hear me well. I am not a cat, as the latest saying goes. And for the record, Peter Bragdon, representing Get Insured. And just want to cover a couple of things that I've heard and answer questions, and I'll stay around for the end too if more questions comes up. You know, the main reason why the statute says we're going to use a federal exchange in New Hampshire is back when the Affordable Care Act passed. The legislature was very concerned that the state would try to build its own system and fail very badly, at which point the citizens of New Hampshire would be really in a bad spot. We didn't feel the department or the state had the resources to do it and do it right. Other states have experienced that. They tried to do it. Get Insured was actually hired at that point to do the exchange for California. And that was their first, California. And then the folks in Idaho said, hey, that's working pretty well. Let's do that. They switched over. Washington switched over. Minnesota switched over. Nevada, Pennsylvania, New Jersey have all switched over to Get Insured. Some of them had their own in-house system that was not working well. And as Ahmed had mentioned, 4 of them actually converted from a federal exchange. An important thing to note is the money saved by switching is money that premium payers are paying. And depending what you do with it, the federal government can match that at 3 to 4 or even more to 1 to provide even more savings to premiums to insured people. So it's important to note that there's some leverage there for doing this. I think Senator Bradley had asked if it would be good to refer the bill. Instead, hang on to it. Maybe the department can do this on their own. But I'll refer you to the statute that's referenced in the bill, which is 420 RSA 420-N:7, prohibition on state-based health exchange. It starts out by saying, no New Hampshire state agency, department, or political subdivision shall plan, create, participate, or enable a state-based exchange. So I really think that there would be some challenge to the state, to the insurance department from some who may say that that language is pretty clear and they can't do anything. And that's why this bill starts out by saying, notwithstanding what that says, we authorize the insurance department to do this. So I think it's probably best and more expedient to pass this along, let the department do their diligence. And I think it was also Senator Bradley that asked about to maybe send this to fiscal as well, which I think is a good idea. I mean, it's mostly insurance premiums that are affected by this, but there is a lot of state overlap. It will definitely affect various areas of the state. So I don't think that's a particular issue. And I think those are the key areas. Again, this, as Senator Rosenwald said, this is enabling. It basically allows the department to study something that has the potential to not only save people money, but also to leverage more federal funds to save the people even more money. Recall, we did that on the individual exchange this past year. setting up the reinsurance pool and the 1332 waiver to reduce health insurance rates. Plus, it provides a ton of data that providers like Senator Sherman I know are very excited about the ability to see the data and use that data to help reduce the number of people in New Hampshire that do not have insurance. So I'm happy to answer any questions you may have, and I'll hang around if there's questions at the end also.
Are there questions of Senator Bragdon?
Senator Sherman has one.
I'm sorry, Senator Sherman.
Thank you, Senator Bradley. I just had a quick question, and thank you for your testimony. What currently happens to the data? I understand it goes to the federal government. Would that change? Would we be able to keep data on our residents in New Hampshire, not have to send it to the feds? And could that data be used to really look at our utilization practice, gaps, and other areas that since we don't have access to that data, could it actually make us more efficient in our delivery of healthcare, potentially saving money for our both our ratepayers and the state?
Thank you for the question, Senator. My understanding, yes, is the information about New Hampshire residents now goes down to the feds. Under a state exchange, that information would stay with the state, and yes, it would be very helpful in targeting gaps to find out where are there people that don't have insurance, and how can we get information to them or provide assistance to them to allow them to get insurance, which then has public health benefits as well as financial benefits.
Further questions? So, Senator Bragdon, let me ask you a question. If we were to pass this bill, but if we were to substitute the sentence, if in the department's opinion, starting on line 7, with the following: the department shall report its findings to the governor, House Speaker, and Senate President by November 1, 2021. Does that satisfy your concern about the notwithstanding, but also satisfy my concern about jumping out too far too fast without adequate oversight? It would mean that the legislature would have to come back and authorize moving forward with a state-based exchange, but the initial research would be done without the problem you cited.
I think the key thing here is to get this moving as quickly as possible, get people looking into it. And I do agree with DJ and others that, I'm sorry, the Deputy Commissioner, that yes, it needs to come back into some way to a legislative body. We initially thought the Joint Healthcare Oversight Commission would be good because that's where the 1332 waiver went last time, but DJ had some good suggestions for places it can go. So I think it's a policy matter as to whether you want those legislative bodies, which you've already given that authority to do things like that, or you want to come back to the full legislature.
Okay. Great. Thank you very much.
At this time, Senator, I have nobody else signed up wishing to speak. If there's anybody who'd like to testify on this bill, please raise your hand or press *9 if you are on the phone. I'm not seeing any hands, Senator.
Mr. Chairman.
Senator Gray.
Yeah, if BJ is still on there, I would like to ask him a question about delaying the decision on this for 6 weeks, which would still get us to crossover and letting the department do what they could in that 6 weeks. And I want to know from the Deputy Commissioner if that 6 weeks would be a meaningful time and provide us with additional information that we could use to make the decision.
Do we see if DJ's still on the line? There he is.
Hi, Senator Gray. Thank you for that question. I mean, obviously, the more time the department is provided, the more detail we can provide in the report. But if you give us 6 weeks, we'll turn around something as best as we can in that amount of time that includes as much information as we possibly can.
Thank you.
Any further questions on Senate Bill 121? Okay, seeing none, I'm going to close the hearing on Senate Bill 121. We will open the hearing on Senate Bill 123. Senator Sherman is here and is recognized to introduce this bill.
Thank you, Senator Bradley. I am, for the record, Senator Tom Sherman, District 24, introducing, SB 123 relative to co-payments for COVID-19 testing. The impetus for this was several of my constituents came to me with concerns that they were being asked by their employer to be tested prior to being able to return to work, and that they were having to pay for the testing, although it was not deemed first medically necessary, nor was it, so it was not falling under federal statute. And then it was also not covered by their co-pays because it was not deemed federal medically necessary. So I introduced this bill. I think there does need to be a small amount of work on the bill because in the fiscal note, which is not, which you may or may not have in front of you, this bill does have the concern of being so specific about employers that it doesn't allow any other payers. So for example, counties have, they pay for half of their employees testing and the other half is paid by the state. Under this bill, it would take away the ability for anyone else to cover this. It would be solely by the employer. So I would like to have the ability to take this back and do some work on it to address the concerns that have come up in the last 24, 48 hours from carriers and also from the counties.
Okay.
With that, I'm happy to take any questions.
Are there questions of Senator Sherman? Seeing none.
At this point, we only have 3 other people signed up to speak on this bill. I will bring in Holly Stevens next.
Good morning, Holly.
Good morning, Senator Bradley and members of the committee. For the record, I'm Holly Stevens, the Health Policy Coordinator at New Futures. New Futures, as I'm sure you all know, is a nonpartisan nonprofit organization that advocates, educates, and collaborates to improve the health and wellness of all New Hampshire residents. And in this role, we work extensively with policymakers, healthcare providers, and families to improve overall public health and improve health equity across the Granite State. Now, my reading of this bill, and Senator Sherman seems to have disappeared, is solely looking at the copay of a COVID test and doesn't have anything about the employers. I thought that bill was in the omnibus legislation, but I could be wrong. So my testimony is on the bill as I read it. So much of my testimony is not going to come as a surprise to you. The COVID pandemic is the worst that we have seen in modern history. Not only is it deadly, it's impossible to predict how it will affect a single individual once he or she is infected. We've seen very young, healthy people die from this. And we've seen some more mature adults who have some medical issues survive just fine. And in some cases, as hit very close to home to the state legislature, the virus can be very quick to render a person defenseless, and then the person would succumb to their illness. And unfortunately, the symptoms of COVID are very similar to other viruses, making it impossible for a person to know if they've been infected by COVID or some other illness like the flu. New Hampshire's Department of Public Health has said over and over, if a person has any COVID symptoms, that they encourage that person to get tested. Even if the person's been vaccinated and they develop symptoms, the Department of Public Health is telling folks, get tested, because you may, even though you've been received the vaccine, you may still be able to be infected by the virus. You may not get extremely sick by it, but you may be able to pass it on to others. And because of that, there really should not be any barriers that have a chilling effect on people seeking a COVID test. The research has shown that copays, even small ones, can discourage a person from seeking needed medical care. According to the Commonwealth Fund, and this is an article that I sent in with my written testimony, one study found that a copay as low as $12.50 discouraged women from obtaining mammograms. And without doing an appropriate research, it's impossible to know. I apologize, that was my phone letting me know I have an email. So I apologize for that. Without doing appropriate research, it's impossible to know what this quote unquote sweet spot would be for a copay that wouldn't discourage somebody from actually obtaining a test if they thought they were sick. And given the deadly nature of the virus and our knowledge that it's not going anywhere anytime soon, barriers to testing must be reduced or eliminated. And this bill only has to do with testing, it's not treatment. So this would include ensuring that commercial insurance products sold in New Hampshire do not charge a copay for testing, or whether that test is done in or out of network. While networks are a cost-saving measure, a Granite Stater on vacation across the country should not be dissuaded from obtaining a COVID test simply because there are no in-network providers available to them. So simply put, given the unpredictable and deadly nature of the COVID-19 virus and the chilling effect copays have on testing, Senate Bill 123 would go a long way in saving healthcare costs and the lives of Granite Staters. And as I mentioned, included with my written testimony, I also submitted 2 reports that outline the effect of copays on people seeking necessary medical treatment and or necessary medications. So it's hard to know exactly what a COVID test, what people would or wouldn't pay out of pocket, or whether they just decide to ride it through. So we would ask that the committee strongly consider this bill and urge you to vote ought to pass. I do know there are some concerns from the insurers that some out-of-network providers, if this bill were to pass, would exploit it and take advantage of that. And I completely understand that. But I'm wondering if we might be able to tweak it somewhat so that Granite Staters are still protected, but that the insurers aren't paying through the nose for testing from out-of-network providers that just come into the state, set up shop, and just run tests. So that is my testimony for today. And if you have any questions, I'm more than happy to answer them.
Are there questions of Holly? Seeing none. Thank you very much.
Next person I have signed up to speak was Sabrina Dunlap from Anthem.
Hi, thank you. Can I just clarify one thing? Is this for SB 123 or 132? Because I heard Senator Sherman mention.
No, it's 123. There's
Okay.
a similar provision in 132, which will have a hearing next.
Okay, because I didn't notice in 123 as it's drafted in employers. So just wanted to clarify. Okay, so I am testifying on SB 123. Thank you, Chairman and members of the committee. I'm Sabrina Dunlap, Director of Government Relations at Anthem. I did sign in opposition to SB 123, but I did so reluctantly. We just respectfully question the need to put this into statute when this issue is already covered by not only federal law, but also the New Hampshire Insurance Department. And importantly, I want to note Anthem was out in front of this last March, making the decision to proactively waive cost share for testing before we were required to, because we recognize the importance of this to our members. And I can't speak for other carriers, but I think others were also out in front of this as well. So in addition to the action we took on our own, as I mentioned, both the Federal CARES Act and a New Hampshire Insurance Department order require coverage of testing without cost share. That's in-network and out-of-network as well, if an in-network provider is not available. And I think as things change with this pandemic, agencies like the New Hampshire Insurance Department are best suited to respond quickly to changes related to insurance coverage and govern these coverage issues. And I think that agencies and mechanisms that we need to respond nimbly to an ever-evolving public health crisis are in place. And I just don't think this is an issue in need of a legislative solution. So again, we recognize and fully support the importance of waiving cost share for testing. That is why we're doing it. That is why we were out in front of this last year. And we just respectfully question the need for this legislation. So I appreciate the opportunity to speak on this, and I'm happy to answer any questions. Thank you.
There are questions of Ms. Dunlap. So my understanding, having been tested a couple of times, that was not medically necessary for travel purposes, and having talked to a lot of people who have asked my advice, there has not been any cost share, that you just make an appointment and get tested and there's no cost to the individual. Is that not correct in New Hampshire today?
So as far as I know, that is correct, that when you get tested, it's ordered by a provider. I know and for sure for Anthem, we are covering all of that testing without any cost share. We are waiving all cost share at this point.
But even if you're not asked by a provider to get tested and you get tested, it's my understanding that there is no cost sharing, there's no cost to the person.
So this gets into a little bit of a different realm, I think, where we start to make distinctions between, testing for public health purposes and travel versus testing for diagnostic purposes. But I will say, as far as I know, at the moment, if you go get a test, it is covered without cost share. And I think, I'm not sure, I'd have to double check. I'm not sure that it really makes a difference who orders it at this point. But I do think this does open up a sort of bigger conversation about the sorts of distinctions made for different types of testing, which I do think SB 132 sort of gets at more with bringing in the issue of employers requesting and requiring testing.
Okay. Further questions? Okay, seeing none. Go ahead, Griffin.
Last person I had signed up to speak is Tyler Brennan from the Insurance Department.
Good morning, Tyler.
Oh, hi.
You still have Sabrina up.
Yep.
Okay. There we go.
Good morning, Tyler Brennan with the New Hampshire Insurance Department. And we do not have a position on the bill. We do have some concerns. By way of background, COVID testing has been readily available in New Hampshire. In fact, some of the latest information indicates that more than 600,000 people, or 600,000 tests have been done in New Hampshire. There is a insurance requirement for network adequacy, and this applies to all the products that are sold in New Hampshire, and that includes lab testing. As a part of that network adequacy requirement, if there are no available local providers that are in network, the carrier does need to cover whatever service it is out of network. So at some level, we've already taken steps, and this is true for not just COVID testing, but for any of the services identified in the network adequacy rule, which is virtually all of them, one way or another. We do oppose the coverage requirement for out-of-network testing without restrictions. We have seen, and there are federal requirements for providers to post their rates when they're out of network. And but that being said, the media, including the New York Times, has covered some of these price gouging examples, including $6,000 COVID tests. The quality of the tests could be unfavorable. Remember, these are providers that are in network. The carrier doesn't know anything about them. The New Hampshire legislature has even imposed requirements on carriers that their in-network providers be credentialed. So it would be requiring coverage on an out-of-network basis, which means paying charges because that out-of-network provider has no relationship with the insurance company. There is no agreement about what the reimbursement rate would be. So it creates a great opportunity for companies that may take advantage of a policy like this. So we would strongly encourage you to remove that section of the legislation and really rely on what are existing state requirements for access to network providers. In the example given about somebody being on vacation, going someplace else, New Hampshire does have broad networks, particularly compared to other states. Some of the individual products tend to have a little bit of a narrow network. That being said, patients tend to have access to some of these national companies that include provider locations everywhere. Some of the national chains like LabCorp and Quest are some of those in-network providers that people could potentially see. That being said, I think if you're on vacation and you don't know who to go to, which might be the case, you could contact your insurance company and say, look, I'm sick, I need a COVID test. Where should I go for an in-network service? It's much better than just kind of going to whatever provider is out there when we know nothing about that provider or whether or not they are embracing sort of business practices that have any level of integrity. So I'm happy to take any questions, and thanks for the chance to speak.
Senator Whitley.
Thank you, Mr. Chair, and thank you for taking my question. Are you aware of any sites in New Hampshire that are currently charging copays?
So thanks for the question. That I should have addressed that as well. There are requirements to have access to COVID testing without cost sharing now. Some of them are tied to ACA products. Some of them are tied to the public health emergency. Some of them are tied to Department of Labor requirements. So to the extent people aren't facing cost sharing with COVID testing now, that's a patchwork of requirements. At the end of the public health emergency, some of the people protected today could potentially face some cost sharing. And I mean, grandfather plans are kind of an example of that. That being said, who knows what future policy will embrace at the end of what will hopefully be the end of the public health emergency.
Senator Sherman.
Yes, thank you, Tyler, for your testimony. As I'm sure you're aware, the intention of this bill is similar to Section 3202 of the CARES Act, which actually already waives cost sharing for out-of-network testing. You probably also know it extended the waiver of cost sharing in the Families First Coronavirus Response Act to out-of-network situations. I just am wondering, are you speculating that somebody who's sick, who's out of state or out of town, would call their insurance company and ask them where should they go before they go, and then if they don't, they would actually have to incur all of the cost sharing on that out-of-network provider? It sounds to me like this is speculation, but I just want to know, what is the evidence that actually backs up your testimony today?
I think the evidence that I would refer to is the evidence that's been produced in the media. And I mentioned the New York Times, but other major media have reported on $6,000 tests. And the federal requirements are pretty limited. And frankly, we don't have a lot of confidence in them to protect people from some of the exposure. The provider is supposed to put up their charge for the lab test someplace on their website, that kind of thing. So even if they do, and in some cases we've heard they have not, and patients have gone there and the assumption is they're still going to get coverage, then that's where the exposure is. And again, because that provider is not in network, we don't know anything about them. We don't know anything whether the sort of the quality of the tests are going to be good, whether or not they're going to follow through. So it just raises a number of questions, as it would with any provider that is potentially taking the opportunity of the coverage requirement such as this.
Senator Sherman?
So it sounds like you are saying, I just want to clarify that this bill really is needed because there is not adequate federal protection for those patients.
No, the protection is essentially the exposure, the financial exposure to the system, the carrier's requirement to cover these out-of-network testing. So a $6,000 test presumably would be covered by your insurance company, and that going to such as an out-of-network provider, or even one that has complied with federal requirements to post their charges for tests. So, I mean, to the extent somebody could get exposure to an out-of-network charge amount, I guess I'd have to know a little bit more about those circumstances, but I don't see the bill solving all of those challenges.
So one last question.
Mm-hmm.
You know, I think one of the roles of the department is to make sure that the consumer is protected. And it just sounds to me like this bill would make sure that the consumer is protected. And then if that $6,000 charge came in, that consumer would be protected. And a very large entity, whether it's Anthem or Harvard Pilgrim, would actually have to protect that consumer as well, but they would have the clout of a multi-state corporation to actually take on that $6,000 charge. Whereas the consumer, if we don't have this kind of protection, wouldn't you agree that they would be left having to defend themselves after the carrier says, we don't have to cover that? It's not covered adequately by the federal statute. So where is our responsibility here as a department, or where is the responsibility of the department? Is it to protect the consumer or to protect the carrier when you come in and bring this testimony forward? It would seem to me it would be first the consumer.
Yes, well, we're simply enforcing consumer protection laws. The one catch is that there is the expectation the consumer go to an in-network provider. And we have really high standards in New Hampshire, and we have really high participation from providers to be in network. So to the extent we're trying to solve a problem with a patient going out in network, access to the COVID testing is not demonstrated to be a barrier today. So to the extent you can go to an in-network provider, get your COVID test, you should be protected in those cases. Once somebody perhaps learns about legislation like this, they no longer need to go to a network provider. And that's where we run into problems. And that's the main point.
Further questions? So Senator Whitley.
Thank you, Mr. Chair, and thank you for taking another question. Wouldn't you agree that, you know, as a state, we should be focusing on removing any barriers to testing, particularly for low-income folks in the midst of a crisis that is impacting folks across the board, including reopening our economy fully, getting kids back to school? Wouldn't you agree that we should be doing everything possible to remove any barriers to getting tests, while also balancing exposure, but that the priority should be improving the mental health or the public health crisis going on?
I think generally it's certainly a good goal, but there is a very consistent legislative intent to be concerned about health insurance premiums and the cost there. And the number, I couldn't tell you the number of times a legislator said to me, what can we do to control the cost of health insurance? Well, we are putting this up as a big sign of caution. If you open the doors, you allow people to go get coverage for $6,000 tests out of network, that's the kind of thing that drives our health insurance premiums. To the extent the state has done a number of things, including the legislature, to impose network adequacy requirements on carriers, those are the kinds of consumer protections I think you're referring to and are consistent with that goal to really protect consumers, give them the best access to providers that we can.
Further?
Thank you. So could we if we agree that, we need to be doing everything possible to address this public health crisis, get people tested, get the economy open, get schools open, balancing what we were talking about raising premiums. Personally, I would rather save lives at this point. That seems a priority. I hope you would agree with that. If we could put in some cost protections in this bill, would that satisfy your concerns?
So yes, I think to the extent you could impose cost sort of controls one way or another, that would, that essentially you'd be adding kind of another layer of consumer protection. But I'm not sure how you could do that because, again, these are added network providers that would be able to do whatever they want because they have no relationship with the insurance company. But that being said, sort of open-minded to opportunities that would deal with these opportunistic providers that could take advantage of legislation like this.
Further questions? Okay, I have a couple. So you cited the New York Times article for a $6,000 test. When was that article published and where and when was the test conducted?
The test was not conducted in New Hampshire. There were a couple examples and I'd have to dig out the report. It was not one within the last month or so, but it was not at the beginning of the pandemic either.
And are you aware of anyone in network or out of network seeking to get a test in New Hampshire that's had to pay any co-payment or any cost sharing for a COVID test since the CARES Act passed?
Only when there's been a billing error, and that's been sorted out. So no, and that again goes back to robust networks, network adequacy standards that ensure that carriers make sure there is access to network providers. So basically the system is working now to protect consumers and give them access to COVID testing, which is part of the reason that if you open the doors, you may unhinge what has been a good situation and create a fair amount of financial exposure.
I could see some merit to this bill if people were having to pay cost sharing or any of that in New Hampshire. And it seems to me, at least the current status of where things are in New Hampshire, that the only people that potentially see a cost sharing are if you get a test outside of New Hampshire and then may or may not be covered by your insurance carrier, but it sounds like it is covered under our current format. Isn't that correct?
I hope I understand your question. And if I do, yeah. So it is covered. We are, what we.
Well, if I get a test, let me make it simple. If I get a test in Massachusetts, wherever I get a test, and I have Anthem, it's in all likelihood covered, even if it's out of network to Anthem because I'm out of state, or Harvard, or Freedom, or Ambetter. Isn't that correct?
In all likelihood, then yes, you're right. It's being covered without cost sharing.
Okay. Senator Sherman.
Just a quick follow-up. Would you believe that without mentioning any names in the interest of confidentiality, we do have a senator who was billed $150 for a COVID test that was not covered. It was denied by the insurer. So the reality, Tyler, is that it is happening in New Hampshire. It is happening out of network. It's happening outside of New Hampshire. So what is the consumer protection process that you would have within the department for someone who is aggrieved because they are having to pay cost sharing and their insurance company is denying either the federal protection or they're denying the coverage on their own within their own policy?
I would say that I am surprised to hear that. We are watching the consumer complaints. We're talking to the carriers every 2 weeks. So I am surprised. That being said, I don't know what kind of coverage this particular person would have. And so remember, we regulate what is a relatively small percentage of essentially the types of coverages people have. That's the fully insured products. That being said, half of us are under self-funded. People are under Medicare, potentially under Medicaid. And so to the extent that the complaint might have come to us, I think that's the best place to start. Our consumer services folks do try to coordinate, even when we are not the regulators. But I am surprised to hear that because, again, we have had a few billing errors come up, and including providers that potentially billed for a rapid test, billed the patient rather than the insurer, things like that. But again, it's rare. It's been very rare.
So if I could, Senator, Mr. Chair, last follow-up.
Yep.
So I guess my question is, what is the formal appeals process in the Department of Insurance for someone who is aggrieved, whether it's being charged copays on COVID testing? Do you have a robust system? Because it sounds like you're saying that it shouldn't happen.
That's correct. And I would think that the place to start is with our consumer services, and you can access that either through the website or by phone.
Okay, seeing no further questions.
Thank you.
So I had a couple of hands pop up. Some of them have gone back down, but one that's been up throughout is Donald Funstein.
Good morning, Donald.
Good morning, Mr. Chairman. Thank you for the opportunity, and I'll be very quick. For the record, I am Donald Funstein. I have the pleasure of working with my colleague Heidi Kroll on the AHIP representation. I wanted to get right to Senator Sherman's questions around data points. And in the USA Today edition of September 15th, 2020, it was an interesting story about what you've heard this morning about the price gouging with respect to out-of-network COVID testing. And I find that one interesting because we had a physician who worked for a chain of freestanding emergency rooms. This was actually located in Texas. He had a COVID-19 test done at his employer. His insurance plan was billed $10,984 for the test, and the insurer paid the bill. Now, everybody can find an unusual, extreme example, but I thought that was one that was particularly noteworthy. Getting aside from just the extremes, let's look at the data, or at least some surveys of the data which has been reported. The average cost for a COVID-19 test in the commercially insured market is $130. The average cost for an out-of-network COVID test is more than 40% higher at $185. And why is that? The reason is because they can. If you segment the data further, you can find 16% of out-of-network COVID tests cost more than $390 a test, which, if you lay it across the country, that's a pretty big hit for the healthcare system. And again, why is that? Because they can charge it, and the insurers are required to pay it. So those are the type of data points which are out there. I agree with what Ms. Dunlap said earlier, and also with respect to Mr. Brennan's comments from the department. My personal knowledge, and it's simply limited to that, It's not an issue here. And if there are situations such as described by Senator Sherman with respect to another member of your body, I can assure you, if you call the insurance department and it's a commercially insured writer in New Hampshire, that will be solved before the end of the day. And that's frankly the first one I've heard about it. I'm sure there are others, but with that, I'd be happy to answer any questions, but I would urge you to take the caution exercised by Mr. Brennan and come down on the side of recognizing there really is no current need here in New Hampshire for this. Thank you very much, Mr. Chairman.
Questions of Mr. Funstein? Very good. Seeing none.
I have nobody else signed up on the sign-in sheet, but hands are coming up. Sabrina Dunlap would like to testify for a second time.
Okay.
Thank you. Thanks so much. Just a quick point of clarification, Sabrina Dunlap for Anthem. So on the copay issue, Senator Sherman, to the point of a senator getting a copay, we all adjusted as quickly as possible last year to the pandemic. And there were a couple, maybe one or two situations where we actually had patients directed to us from the insurance department and we helped figure out the issue. And in the one case I'm thinking of early on, it was clearly a billing problem. And so it comes in incorrectly to our system and the person was incorrectly given a copay or had to pay a copay. And we sorted it out. And so we want to work with the department to make sure people aren't getting hit with copays at all. And really, to Tyler's point, we have not heard of any issues, I don't think, since last spring. So just wanted to point out that when the issue did come into us from a constituent, we worked very quickly to get it sorted out. So thank you so much for the opportunity to speak again.
So I would just ask the same question I've been asking all morning. It's the 10th of February, 2021. And while there may have been payments that were required early on in the pandemic, this legislation would be on a going forward basis. To the best of your knowledge, Ms. Dunlap, is there anyone in New Hampshire, either covered by Medicaid, Medicare, VA healthcare, or commercial insurance, or uninsured, that's paying anything for a test in New Hampshire?
To the best of my knowledge, none of the groups you mentioned are paying or should be paying for tests. And I can't speak to the uninsured as much, but I'm fairly certain that the state covers testing for them. But certainly the other groups you spoke of, they are not and should not be getting billed cost sharing.
Okay, great. Thank you. Is there anyone else? Griffin.
I have Holly Stevens wishing to speak a second time.
Hi,
Go ahead.
Senator Bradley. Thank you for allowing me to speak again. I will be really quick again because I know you're behind schedule and have a lot going on this morning. I just wanted to point out that entities like LabCorp and Quest require a doctor's order. You can't generally, other than this state of emergency, just walk into one of those entities and say, give me a test. If that was the case, Representative Edwards wouldn't continuously bring back his bill that would allow those actions to happen. You need a doctor's order. Right now, the only reason you can walk into a Walgreens or a CVS or a Quest is because they have a standing order in place under the emergency order. Once the emergency orders are gone, those are gone as well. So a person who is out of state, even if they know Quest is an in-network lab, they can't walk in there and get a test without a doctor's order. And as you're 100% right, no one's being charged right now, Senator Bradley, because of the protections that are in place. once the emergency is over, again, those protections go away. And, you know, bills are only brought in New Hampshire once a year. And the insurers always ask for a year ramp up time on any mandate so that they can adjust their premiums. So, you know, I'd ask just to consider those items as you discuss the bill as well. And thank you so much for allowing me to testify again.
Okay, thank you.
I'm not sure if it's an error, but Donald Funstein has his hand up again.
I think it's an error.
Okay. Oh, it's down. Okay. So other than that, I think we're good.
Okay, I'm going to close the hearing on Senate Bill 123.
Senator, I think Senator Prentice has her hands up.
I think she meant
She
to raise
is
her hand
ready
for
to
the next bill.
testify on her bill.
No, I think she wanted to say something on this bill.
Well, I would ask Senator Prentice to hold her testimony for her bill, which is going to come up next, if that's okay.
But my understanding is that she wanted to testify on this bill or provide
All
input
right.
on this bill.
Senator Prentice?
Yes, I'm here. Thank you. Sorry, Senator Bradley. Just quickly, I wanted to add that I have in front of me a bill when I went non-medically necessary to have a COVID-19 test and had a $242 charge, and I had to pay the balance of it, which was $151. That's all I wanted to add. Okay, thank you.
This time I don't see anybody else wishing to speak, Senator. I think if Senator Prentice is here, she can stay in and introduce her bill next.
So what I'd ask is that Senator Prentice stay in. There'll probably be questions on her bill as well as the co-payment bill, but we're going to take a 3-minute break. We'll come back at 10:05. Griffin,
Yes, sir.
how are we doing?
We're doing fine.
Okay. The time being 10:06, let's open the hearing on Senate Bill 132, and I'll recognize Senator Prentice, who is the prime sponsor of the omnibus legislation. And Senator Prentice will speak to sections 1 and 2.
Thank you, Senator Bradley and members of the committee. I am, for the record, my name is Suzanne Prentice. I am the state senator for District 5 here along the Connecticut River, the beautiful Connecticut River Valley. This morning, I am bringing to you, as Senator Bradley said, 2 parts of a 4-part omnibus legislation relative to COVID-19. So section 1, it would require employer payment for COVID-19 testing. Quite simply here, this is a well business bill where if you are an employee and you are required to have a COVID test to come to work or come back to work, and you don't have insurance to cover that because it's not medically necessary, that the employer would reimburse you for this. And again, this is, for employees that don't have either the insurance or because it's not medically necessary, it is not covered, or they don't simply have the funds to do it in order to go to work. I believe it's our responsibility to work with the employers to assist them. And I also believe that if I am running a business, I want to make sure that the members of the public know that my business, my organization is running at the highest level of public health and public safety, including not just wearing masks and washing hands and socially distancing, but making sure that those that are serving my customers are tested for COVID-19. And I think that this could accomplish both of those. So on section 1, that is my introduction. And Senator Bradley, if you'd like, I'll take any questions at this time.
No, why don't we move on to section 2 and then there'll be questions.
Thank you very much, Senator Bradley. So section 2 is establishing a COVID-19 micro enterprise relief fund. So this accomplishes a few things. First of all, micro enterprises are defined by housing and urban development at the federal level as businesses that have 5 employees or less, including the proprietor of the business. That during this time of COVID-19, we know, and I know specifically in my district, but I've heard from others throughout the state, that we have seen these smaller businesses impacted the same as some of the larger businesses, but their ability, their bandwidth, their bench, and their ability to stay open and deal with the losses without the appropriate time and resources to pivot to more sustainable business practices, to an e-commerce type of platform while keeping their storefront open, if they even have one, is more of a challenge. This bill would do a few things for those businesses. One, it would direct federal dollars that came to New Hampshire for the public health emergency called COVID-19 to be set aside into a fund of up to $1 million, and that would be broken. And I actually have an amendment. I hope everybody has the sections of the bill have been amended, but I'll give you the overall, that these the regional development corporations would be through the BEA, our department would be, this money would be broken up between those groups so that are on the ground, on the front line, know the businesses that are in trouble and how to help them, and would be responsible for actually running this grant program. And I also want to point out that this focuses not just on the emergency, the pandemic that we see before us today and how this has impacted the economy and our ability to recover, but by doing this, we put these smaller businesses in a better position sustainability wise for into the future as a micro enterprise here in the Granite State. I also want to note, and I can go over my amendments to the different sections when the time is appropriate, that I have reached out to Commissioner Caswell. We do have a meeting tomorrow. I've also worked with the regional development councils, and I'm hoping that that Commissioner Caswell and I can work on some areas of concern that he has raised to me in order to make this the bill that it needs to be to benefit the micro enterprises here in the Granite State. So I will stop there. And again, I'm happy to, you have the amendment in front of you, address any of those, address the amendment if it's appropriate, Senator Bradley.
Okay, so are there questions of Senator Prentice on parts 1 and 2 of Senate Bill 132? So I have one question. I'm looking at line 24 of page 2. This would not be a general fund expenditure. The $1 million or up to would only be if there were federal funds received.
That is correct, Senator Bradley.
Okay. Further questions? Okay, seeing none. Let's see, I believe Senator Rosenwald is the prime sponsor of section 3.
And I'm here. Thank you, Mr. Chairman. For the record, I'm Senator Cindy Rosenwald, District 13, representing 6 of Nashua's 9 wards. And I'm pleased to introduce part 3 of this omnibus bill. This section is known as the Protect New Hampshire Veterans and Seniors Act of 2021. From the very beginning, when the COVID-19 virus first arrived in the US on the West Coast more than a year ago, its worst devastation occurred in nursing homes, and so too here in New Hampshire. In fact, the pandemic has been crueler nowhere here than in our long-term care facilities and our state veterans home. We saw this coming last March, and we discussed at the time the need to protect long-term care facilities and the veterans home with Dr. Chan. But for all the department's work and good faith efforts, New Hampshire really has just about the highest, if not the highest, long-term care death rate in the country. Right now, 790 individuals out of 1,100 deaths in New Hampshire, about 75 to 80% of our deaths. The Veterans Home managed to do a great job and keep the pandemic at bay until November, but then they experienced 35 deaths in a short span. And that is 18% of their residents. In a typical season, the Veterans Home tells us they lose about 10% of their residents to influenza or some kind of diarrhea illness like norovirus. So this is much more lethal. And even beyond the sickness and the death, the isolation of our frailest seniors and veterans is also terribly cruel. And I can't even imagine the loneliness of these seniors at the end of their lives, unable to visit with the people who love them. And as the department has frequently stated, we really don't know why or how we can better address the situations. Are nursing homes crowded in New Hampshire? It doesn't appear so, since the census has been running several hundred beds below plan for more than a year. Medicare and Medicaid funding likely are too low. Some of our private facilities are teetering on the edge of closing. Several have actually changed hands recently, including the largest nursing home in the state, which is in Nashua. So part 3 of this bill appropriates a small amount of money, probably, hopefully federal money to quickly hire an outside consultant to help us figure out how to make doing our best even more effective. We do this often with state programs, and I believe our seniors and elderly veterans deserve nothing less. The bill came out of drafting with a date for the release of their report of August 1st. I know that's incredibly fast. However, there was an agreement to fast track this bill. So I think the date is actually feasible, and I hope the committee will look favorably on part 3 of this omnibus bill. Thank you, Mr. Chairman.
Are there questions of Senator Rosenwald? So again, the same question I asked of Senator Prentice on page 3, line 36 and 7. The $250,000 you're appropriating for this would only come from federal COVID-19 related funds.
Thank you for the question, Senator. If that is the first source of funds, however, if you look at page 4, I do allow for the governor to draw a warrant out of otherwise not appropriated general funds if there are no federal funds left over. The request is for $250,000. The last time I looked at what had not actually been spent, it was somewhere around $100 million. So I believe we can accommodate the appropriation out of federal funds, but there is a contingency for general funds if federal funds are not available.
And again, the date of August 1, 2021, wouldn't it be more appropriate to back that up 2 or 3 months?
If the committee wanted to do that, I wouldn't push back on it. I thought about asking you to do it, and the reason I didn't was because of our agreement within the Senate to fast track this bill. However, if we think the House might not be as fast, then I think it would be a good idea to back it up a month or 2.
Okay. Are there questions of Senator Rosenwald? Seeing none. Thank you very much.
Thank you.
Griffin.
I believe the next part is being sponsored by Senator Whitley, so I think I might defer to her.
Yeah, I'm sorry. Yes. Part 4, Senator Whitley.
Thank you, Mr. Chair. For the record, my name is Becky Whitley, and I'm honored to serve New Hampshire Senate District 15, which includes the wonderful communities of Concord, Pennacook, Henniker, Hopkinton, and Warner. So I'm proud today to introduce Part 4 of SB 132, also known as the Save Our Granite Stages Act. So independent live venues are incredibly important entertainment hubs and economic multipliers for New Hampshire's local economies. We know that they serve as critical tax bases for as employers and tourism destinations, and as revenue generators for neighboring businesses such as restaurants, hotels, and retail. And of course, the cultural impact of our independent live venues is impossible to calculate, and also serves as an important draw for young people to the state. But unfortunately, we know that these businesses were among the first to close as COVID spread across the country and our state, and will likely be the last to reopen. It might take years for these small businesses to recover if they can stay in business at all. Smaller venues with a capacity of 300 or less are particularly impacted by both the COVID public health and economic crisis. So this act provides targeted assistance and hopefully some flexibility for some long-term planning support, recognizing the importance of these venues to our economy. So specifically, the bill updates the declaration of policy for the Council on the Arts and establishes a fund for the purpose of providing grants to both nonprofit and for-profit live venues that did not receive a grant from the Shuttered Venue Operators Program in the most recent federal relief package. It then directs a portion of any additional discretionary federal relief funds to this fund and allows for the receipt of other funds as well. So I will let you know that we worked closely with Ginny at the Council on the Arts on this bill and with lots of our incredible live venues in the state. Some of them are here to testify today. Senator Bradley, to your question on the prior portions, we should, I think, look at if the committee is so inclined to make this portion effective upon passage rather than waiting to the summer. But we can discuss that as a committee. So with that, thank you so much for the opportunity. And I look forward to hearing the testimony from the live venues that we have on the line today.
Other questions of Senator Whitley? I am just looking at this again. I don't see an appropriation.
Yes, I'm
that
sorry.
correct?
Thank you for that. Thank you for that question, Senator Bradley. And I neglected to mention that we have an amendment that the committee should have, Amendment 0302S. And that creates the fund and then directs the additional federal discretional money to that fund. So you should have that amendment.
Griffin, could you make sure that we all get that amendment?
Yeah, I can. And just to confirm, Senator Whitley, is that 0302S?
0302S, and I believe Jeff sent it to you last night.
Yep, it should be on the OneDrive for all the committee members, but I will email it to everybody right now.
I do have it on my drive.
All right, seeing no questions of Senator Whitley, let's go back, Griffin, to section 1. And is there anybody that wishes to testify on section 1? Please raise your hand.
The only individual I see wishing to speak on part 1 with their hand raised is Doug Marino, and I will bring him in now.
My apologies, Mr. Chairman and Griffin. I actually wish to speak on part 4.
Oh, okay.
Is there anybody wishing to speak on part 1?
I'm not seeing anybody with their hands raised
Is
on
there
part
anybody
1.
from the Health and Human Services Department in the attendee list?
I am not seeing any. There's Melissa St. Cyr. If you'd like me to bring her in to maybe testify on part 1.
I think Melissa's normally licensure, but
I thought I don't see John Williams on here.
all right, okay.
Yeah.
So what I'm going to suggest on part 1 is that Senator Sherman and Senator Prentice try to work together with the carriers and the Department of Health and Human Services to target, whether it's in Senator Sherman's bill or Senate Bill 132. And I think it'd be more appropriate in Senator Sherman's bill because it can move faster if it's deemed necessary to target any gaps that might occur at the end of the emergency order. But does that make sense, Senator Sherman? Okay. All right, let's move to part 2. And anybody that wants to testify on part 2, please raise your hand now.
I have Elizabeth Gray wishing. Oh, sorry. I think Senator Sherman had his hand up.
Do you have a question, Senator Sherman?
No, I would love to say a couple of words. I can wait until the end if that's.
That's fine. Yeah, let's get through the testimony first.
Okay.
I'll bring in Elizabeth Gray.
Good morning and thank you. It's a pleasure to see you, Chairman Bradley and members of the committee. My name is Liz Gray and I am the State Director of the New Hampshire Small Business Development Center, and I appreciate the opportunity to testify this morning. As you know, I am here speaking in favor of Section 2 of Senate Bill 132 relative to establishing the COVID-19 Micro Enterprise Relief Funds. The New Hampshire SBDC works with small businesses, many of which are micro enterprises across the state. Although we are not an official state agency, New Hampshire's SBDC was created as a cooperative agreement of the U.S. Small Business Administration, the state of New Hampshire, and UNH as our host institution. It is a very unique federal, state, and higher ed program, and we appreciate the state's ongoing financial support that allows us to keep this program running in New Hampshire. To give you a little bit of background on what we do and why we're so interested in seeing Section 2 of the bill pass, I'll share just a touch on what SBDC does. We are the state's leading provider of confidential, highly individualized business advising and training for small business. We do all of our work, whether it's our advising or the webinars, the e-courses we provide, free of charge to New Hampshire's enterprises. In 2020 alone, we supported over 7,000 businesses through direct advising and training. And I'm proud to say that we helped our clients access over $44 million in new capital and increase their sales by close to 10 million, despite what was happening with the pandemic. SBDC is able to support businesses in any industry at any stage of growth, whether the business is just getting started, seeking capital, bringing new products to market, or exiting through a sale or a generational transition. And SBDC's advisors can help clients achieve their goals, however big or small they are. Senator Whitley, we're also really happy to say that we've worked with a number of live venues, and Ginny as well at the Council on the Arts. When I talk about small, I mean small businesses with less than 500 employees, because we work off of US SBA's definition. But if you look at SBA's small business profile, New Hampshire pre-COVID, there were roughly 136,000 small businesses in the state. Over 107,000 of those businesses are solo entrepreneurs. Over 25,000 have somewhere between 1 to 19 employees. And then roughly 4,000 or so have the 20 to 499 employees. So small businesses, as I'm sure you know, represent 99% of New Hampshire's companies and employ close to half of all of our workforce. The NHSBDC has proudly worked in New Hampshire for close to 37 years. We were there for businesses through the pandemic with advice and guidance to help them obtain state and federal relief available to them, and we will remain by their side to help them strategically plan a future that leads to profitability, resiliency, and growth. The relief programs that the state provided to businesses through Main Street, the self-employed, the childcare, and agricultural programs were tremendous and helped hundreds, thousands of businesses. However, many of the micro enterprises were not able to access the state or federal relief programs. Some of those reasons, if they started their business after February 15th of 2020, some early stage companies that started in 2019 weren't able to show a loss in revenue in 2020 because in 2019, they either lost revenue or broke even. And other small businesses simply weren't aware that they were eligible for any of these relief programs. And as you all know, the need for relief for our small businesses continues. So programs like the one created by Senate Bill 132 will provide that direct relief to micro enterprises. I was really excited to see Senator Prentice submit this legislation and include the SBDC in it. It builds off of a very unique partnership the RDCs, or the Regional Development Corporations, and SBDC currently have. And it's modeled after a successful program that the Grafton Regional Development Corporation already works through with SBDC support. Like SBDC, the RDCs across the state work directly with small businesses in the towns and cities in each of their regions. There is an RDC representing every community here in the state. Having SBDC and the RDCs work together on this makes a great deal of sense. We also have very close working relationship with chambers of commerce and municipal economic development offices and can get word out about this program. When you're thinking about, how the size of the grant, a grant of $2,500 or up to $10,000 may not seem like a lot of money, but to a micro enterprise, it can make a significant difference and allow them to keep their doors open. As Senator Prentice mentioned, SBDC and the RDCs, we are on the front line working with small businesses. And I feel very comfortable and confident that together with the RDCs, we'll be able to get these relief funds out quickly and efficiently, but also ensure that these small businesses are connected to our support network and other business resources to help them recover and be more resilient. It's not just about getting money out, it's making sure that those businesses understand how best to utilize these very important funds and making sure that they have a connection to an advisor and other resource partners to be able to grow and to be, or just simply to recover, and then hopefully to grow and be more successful in the future. So thank you very much for your time. I'm happy to answer any questions you have.
Senator Whitley.
Thank you, Mr. Chair, and thank you, Ms. Gray, for your excellent testimony. So I'm wondering if you can give us some specific examples of New Hampshire micro enterprises. I think it would be helpful for the committee to hear what these companies actually do.
They are providing a variety of different services. You can think about an individual that works on websites, an accountant, professional services. There are small businesses, again, the micro enterprises that Senator Prentice is targeting is under 5 employees. So many, as I mentioned, well over 100,000 of those businesses here in New Hampshire are solo entrepreneurs. So they will run the gamut in terms of the types of businesses, the types of industries that they represent, and potential job creators to be able to help the economy recover.
Further questions?
Follow up?
Yep.
Thank you for taking my follow-up question. Would you say that these micro enterprises are sort of the incubators for the businesses of the future in New Hampshire?
Without a doubt, yes. You know, obviously our small companies, they start out small, but give them the resources they need and the support network, like an SBDC advisor, like a regional development corporation to provide that seed funding, or other investors helping them to get prepared. They will be more likely to grow and to be more successful. Our national association works with a researcher, Dr. James Chrisman. Businesses that work with an SBDC advisor are 80% more likely to be in business after 5 years than a business that has not worked with an SBDC advisor. So the work that we are able to do, the guiding, the mentoring, the teaching, and providing resources, again, on marketing, on communications, on supply chain development, potentially exporting to new markets, it is having a significant difference in the clients that we're able to work with.
Senator Avard.
Thank you for the question. Thank you for your testimony, Elizabeth. Just curious, in Nashua, we have a few people that are very small businesses that are struggling. Would Olga fit into that category? Olga's?
You know, I would have to chat more with Senator Prentice and the RDC in that area, but there's a very strong likelihood that yes, Olga should, because again, she is a solo entrepreneur, and there are other folks that are working with her, but they are not officially employees. So I believe that's the.
And a little follow-up, if I may, Mr. Chair. Does this also help nonprofits?
That I think I would rather have Senator Prentice respond to that one.
Thank you.
Further questions? So I, Liz, have a couple. I testified on a bill of mine yesterday that was incorporated into the Finance Committee omnibus that would have funded $250,000 for the admin costs for the RDC. So I've long been a supporter of the RDCs and know that they were very helpful early on in the pandemic before a lot of them ran out of funding. So my question is on the 3 parameters in the bill: funds to exceed $1 million, $10,000 up to for a loan, and micro enterprise 5 or fewer. It would seem to me that if we are funding this totally with federal funds, which that was the question I asked of Senator Prentice, that we potentially should go larger than $1 million, larger than 10,000, up to maybe as much as 25,000, which I think is the normal RDC loan, and 10 or fewer employees. Does that make sense to you?
I think I think it would be an outstanding opportunity to be able to provide more support to these businesses. But I also, appreciate the many challenges and competing interests right now with any federal and state relief, state general funds coming in. So I think just hearing more and learning more about the types of businesses that we're working with, I can, reach out to each of you individually and share more about what our advisors are hearing directly from businesses in your districts to help you understand those unique challenges. So back to Senator Whitley, I'm happy to follow up with you at some point and kind of dig in a little deeper on the types of micro enterprises. But Senator, I think any additional relief and support that you're able to provide through additional federal relief money coming in or through the general funds, I think will be outstanding. And like I mentioned earlier, I was excited to see the piece of legislation that you had also submitted, because we have a really great working relationship with our RDCs across the state.
Great. Okay. Seeing no further questions. Thank you, Griffin.
Thank you.
Next, we have Grafton Regional Development Committee.
Good morning. Can everybody hear me?
Good morning.
Good morning. My name is Ann Duncan Cooley, and I'm the Chief Executive Officer of Grafton Regional Development Corporation. I very much appreciate the opportunity to speak this morning. As Liz Gray mentioned, we're one of 10 regional development corporations covering the state of New Hampshire. And like many of our counterparts, we participate in a program funded through New Hampshire Community Development Finance Authority to serve the micro enterprises that Liz described so well. So we work very closely with these small owner-managed businesses. We operate 2 business incubators in Grafton County. We are part of the Dartmouth Regional Technology Center and also the Enterprise Center at Plymouth. And the services of the business advisor, which are available not only to participants in our business incubators, but other small businesses, are really crucial to the suite of services we provide to small businesses in our community. We also offer loans, and our micro loans are now up to $50,000, but we also offer somewhat larger loans as gap funding when a bank is interested in making a loan to a small business that may be a little bit too risky as well. So those are pretty much what we focus on to support small businesses with our lending. In a normal year, this would pretty much be our approach to helping businesses succeed. But as we all know, this is not a normal year. And so immediately after the shutdown in March, we at Grafton put our heads together and said, what can we do with our existing resources to help small businesses right now? And what we came up with then was a website technical assistance program, because many of our small businesses, our rural small businesses, had no web presence or a really antiquated web presence. So we used some very flexible money that had been donated by the Littleton Food Co-op and made immediately available $2,000 deferred, no interest, $100 a month repayment loans to our small businesses to get a web presence. And we partnered with SBDC to reach these micro businesses, and we helped a number of them. For example, we now have a nice website that is showcasing the products of an interior design company in Littleton that had no website before. So that was what we were able to do immediately. But then, they were closed, and the hair salons and the restaurants were worried about how they were going to reopen and bear the costs of buying the PPP and all that sort of items, because there were few funds coming through. So we were very fortunate to receive part of a $100,000 grant from Citizens Bank. and we partnered very closely with our business advisor and dispersed those funds in really small amounts to help small businesses pay for COVID-related costs. And one example that really resonates with me was a hair salon in one of our downtowns. A woman runs it, it's her business, and she needed around $1,000 worth of to reopen safely. And that was a lot of money for somebody who'd had a business closed for quite some time. So we partnered with SBDC, and we got that money to her, and she was able to use that to pay to reopen safely and quickly and get her business going again. So these small grant monies are really hard to find for small businesses right now. There are loans, but businesses are understandably being very cautious right now. And even no interest loans are not attractive. They don't want to take the risk. So having another source of small grants available to help businesses cope and get ready to hopefully ramp up again would be really valuable in Grafton County. And we do have an established network of organizations who really know how to do this. We were able to turn around these grants through Citizens Bank funding very quickly with SBDC's assistance. So we know how to get this money out there and make it really have an impact. So I would be happy to answer any questions, but I would really be very delighted to have some sort of a resource to help these small businesses do what they need to do to get through this crisis.
Are there questions of the witness? Seeing none. Are there any other RDCs, Griffin?
I do not see any. If there are any, I ask them to raise their hand, but I'm not even seeing any.
Okay, great. I think that the Grafton County folks did a really good job, and thank them for that. Do we have anybody from Commissioner Caswell's?
Don't see anybody. If there's anybody from the BEA who's present, please raise your hand. I'm not seeing any hands raised this time, Senator.
Okay. Are there any other people that want to testify on part 2? Then let's move to part 3.
If anybody would like to testify on part 3, please raise your hand or press *9 on your phone now. Melissa St. Cyr.
Good morning. How are you, Melissa?
Good morning, Senator Bradley, members of the committee. For the record, my name is Melissa St. Cyr. I'm the Chief Legal Officer for the Department of Health and Human Services. And I just wanted to speak very briefly to part 3, the COVID nursing home and long-term care audit. The only concern, we are neutral on this bill. The only concern I just want to raise to the committee is the requirement that the department supply information to the independent auditor. The information that the department collects relative to inspections for compliance with regulations, whether they're licensing regulations or CMS certification regulations, are confidential. Now, if the committee and if the legislation is meant to override that confidentiality for licensing, so essentially if the auditor was looking to collect information on an inspection that was conducted for an individual facility's license, against the licensee, that if the committee and this legislation is meant to override that confidentiality and that we would provide that information to the independent auditor, I would just ask that there be a confidentiality provision included into this section, so that the independent auditor would then have to maintain confidentiality of that information that was collected. Clearly, there's a lot of confidential information, personal protected information, personal health information that gets collected on an inspection. So I just want to mention that. And then also under our certification, our CMS survey team goes out and conducts audits of nursing facilities, nursing homes that are certified by CMS. And typically when they go out and do their certification, our licensing group isn't responsible. It is the certification group, and they are bound by CMS regulation. That CMS regulation does not allow for us, because it's a federal law, does not allow for us to give our inspection information, any confidential information that we receive, does not allow for us to share that information with anyone. So I just want the committee to understand and know that we would not be able to give any information to the independent auditor that would be relative to our inspections or survey results. Only the ending report, which is public, and also their license number and licensing information, their certification information, but that is it. So anything related to their inspections or whatnot would be confidential, and we unfortunately are not able to override that requirement, because it is a federal requirement for CMS. And so that's the only thing that I just wanted to let the committee know. Thank you so much for taking my testimony, and I'm happy to answer any questions.
Are there questions of Ms. St. Cyr? Okay, thank you very much. I guess there is one. Senator Sherman.
Yes, thank you. Sorry, I was a little slow to the draw, I guess. But thank you, Melissa, for your testimony. I just have one question. You know that we've been working with the department through the senior support team, and I agree 100% with confidentiality. Would this? How much do you think, given what you know can and cannot be released to this type of trying to think of the right word, this type of audit, would there be enough information available to really achieve the goal of this type of audit, or would it be significantly, would the availability of information be significantly curtailed by confidentiality requirements?
If the goal is to investigate kind of audit the nursing homes, a majority of those nursing homes are certified by CMS, and so therefore the information that the department gathered relative to inspections, notes, and all of everything that we kind of do to inspect a facility to determine compliance or non-compliance with regulations, all of that would remain confidential. So a majority of our assisted living facilities are not certified by CMS. There's just they're like a handful of them. So assisted living facilities are licensed, and in that situation, they would only be bound by state law and regulation. So if you're looking for data to be collected for assisted living facilities, if there is a provision in this that is to specify that the independent auditor can collect that information, that wouldn't be significantly curtailed. However, the nursing home data and information that the department has related to compliance and non-compliance with CMS regulations would absolutely, none of that would be able to be supplied. The only thing that you would receive, the independent auditor would receive, would be the information that is public already, which is the result of the inspection itself.
Follow up. So I think, Senator Morgan's, I think it was a study committee last fall, and those of us who have been working, pretty much daily with the licensed senior residential facilities really would love to understand where are the gaps, not in a punitive way, but in a, in a sense, it's a life-saving way. Understand how we can help support these facilities to make sure that their residents are as protected as possible, both because we don't know what's going to happen with COVID, and also COVID is one pandemic, but we have the flu every year, and we may have another pandemic. That's the way viruses tend to occur. So is there any plan either on the state level or on the federal level that you know of to really try to do that deep dive, this kind of assessment, this kind of audit, to really find out where are the gaps, where are the areas where there could be improvement and help provided, sort of not necessarily negating the need for this, but filling the need for this, filling with better access to the data.
Sure. So thank you. We as a department have certainly talked, a lot about kind of what we're, the information that we have and collected and looking at and analyzing that. Our CMS survey group is certainly collecting information, aggregating it, reviewing it, seeing if there are trends and patterns. Obviously every nursing home is very different, set up very different, and just, the physical layout and the, the policies and procedures and how they, actually care for these individuals. They're all very different. And so it's, as Lori Shibinette has said I think on our press conferences a few times, that collecting all of this information and analyzing is something we definitely plan on doing and looking to see across the department, not just from a survey perspective, but across the department. Was there any trends and patterns? Is there anything that we can do to improve care in nursing homes and assisted living facilities? So that absolutely is a goal. We're obviously trying to get through the pandemic and rolling out the vaccines and doing all the things that we're doing right now and collecting the information. I think as this state of emergency comes to an end, we'll be able to put a better plan in place to do that analysis, to gather all of the information that we have to see if there is any improvements. We certainly work right now individually with each nursing home and each assisted living facility to ensure that, they're getting all the support. So you are correct. It's not just from a punitive perspective. We're providing support on all different fronts for these nursing homes and assisted living facilities right now. But I think the analysis that you're referencing really is something that will come at the end of the state of emergency for us to gather all of the information we have from all across the department to see where it is that we may be able to help and improve upon care and treatment in these facilities.
Thank you.
Further questions? Seeing none. Thank you very much, Melissa.
You're welcome. Thank you.
At this time, Senator, I do not see any other hands raised from anybody who wishes to testify on part 3.
Well then, moving right along.
Oh, I did see Senator Perkins Quokka. I'm assuming it might be on part 3. Oh, hands back down. I'm assuming
Hands back down, moving right along. Senator Whitley, at this point, could you go through your amendment on part 4?
Sure, happy to do that.
Can we have Griffin send that? I went looking for that and I cannot
I
find
think he did because I received it.
Senator, I did send it to your legislative email. If you'd like, I could send it to your personal.
Nope, I'll go find it.
Okay, all right.
Okay, so it retains the purpose statement, just indicating that the live venue is important to our economy. It revises just slightly the declaration of policy for the Council of Arts. We got rid of some reporting requirements and another section from the council. So we got rid of from the original bill sections 4 and 5, but then we added this fund, Save Our Granite Stages Fund. and specifically targeted this fund for those very small venues that weren't able, it's sort of in process right now, to get a grant from the Shuttered Venue Operators Program that was under the federal Save Our Stages Act, under the most recent federal relief. So it's, again, this micro targeting of funds for our very small venues that couldn't benefit from the existing federal relief. And then it funds, thank you, Griffin.
Sorry.
And then, no, it's cool. If you go to the second page.
Yep.
And then it funds this new Granite Stages Fund with $1 million of any additional discretionary federal dollars that the state is likely to get under the new administration. So the other piece that was important that we heard from the council is that this applies to both for-profit and nonprofits. Currently, there's I don't know if it's a prohibition, but the council is not able to provide support for-profit venues. So this fund allows that flexibility, and then allows this new Granite Stages Fund to accept additional donations as well.
All right, so it looks to me, in looking at this amendment, it's the same language that other portions of the bill have, that it's discretionary federal funds. And this is already going, Senator Whitley, into a fund that is already, or is it a new fund also, like Senator Prentice's fund?
Correct. It's creating a new fund. The
Okay.
Granite Stages Fund. Save Our Granite Stages Fund.
Okay. All right. Are there questions of Senator Whitley again on the amendment? Okay, so Griffin, if you could allow anybody who wants to testify on part 4 to come in now, that would be great.
Sure. So I will call Senator Rebecca Perkins Quokka. Sorry.
Good morning, Senator.
Good morning. Sorry to falsely alert you on part 3 there. Thank
Well,
you
you're
for
doing better
having
than me yesterday. I tried to testify on the wrong bill in ED&A.
I think we're all going to slowly go crazy from having 2 Zooms going at once, but
Well, you have even more to think about, being your first term. So you're doing great. You're doing great.
Thank you, sir.
I agree.
Thanks, everyone. So, good morning. For the record, I am Senator Rebecca Perkins Quokka from Senate District 21, representing the city of Portsmouth and the towns of Durham, Newmarket, and the surrounding towns. I am co-sponsor of Part 4 of SB 132, establishing the Granite Save Our Stages Act. As Senator Whitley so eloquently outlined, this bill supports our live venues, especially focusing on our smaller venues. In the Seacoast alone, the arts community generates over $58 million for our local economy in non-COVID times. Not only that, but having an arts scene adds to our life and provides an amenity to help the state retain young workers and young families. With all of our employers clamoring for additional workers across the state, at the state level, we should be doing everything that we can to support the important role in the economy and our quality of life of the arts. We are lucky to have the talent we do in New Hampshire, and in this unprecedented time, we need to take unusual action to make sure we are supporting them. Though $12 million was allocated to this sector through CARES Act funds, it largely went to larger venues. Small venues were able to take advantage of some other Gopher-created CARES Act programs, including the NERF Fund, Main Street, and other federal programs like PPP and economic injury disaster loans, but more assistance remains necessary. Creating the Save Our Granite Stages Fund by allocating $1 million of any future discretionary federal funds that may come into the state would be an excellent start for smaller venues and would allow the Arts Council to do far more for these organizations than it currently can with its small budget. I thank you, Mr. Chairman, for the opportunity to speak, and happy to try to answer any questions you may have.
Are there questions of Senator Perkins Quokka? Seeing none. Thank you very much.
Thank you, committee.
Griffin.
Next, we have Matt Wilhelm.
Good morning, Matt.
Good morning, Chairman Bradley, members of the committee. Good morning. For the record, my name is Matt Wilhelm. I serve as a state representative for Hillsborough County District 42. Part of what makes Hillsborough County 42 such a great district is that it encompasses the heart of downtown Manchester and our historic mill yard, which is why I'm really grateful for the opportunity to testify this morning in support of the Save Our Granite Stages Act, of which I'm a proud co-sponsor. In addition to the SNU Arena and the Northeast Delta Dental Stadium, which are obvious economic drivers for the Queen City, downtown Manchester is also home to a number of small to mid-sized performance venues. Our crown jewel, the historic Palace Theater, it's an 880 capacity performing arts center. It's home to over 350 first-class Broadway-style musicals and comedy and live music and youth theater productions every year, except this past one. And, you know, this is personal for me because before politics, I worked for more than a decade in the live music industry for a number of touring musicians. I cut my teeth selling band merch at dive bars, and then I worked as a concert photographer and videographer, and then lighting designer on the club and theater circuit. And then finally as a production assistant and tour manager as my artists advanced to arenas and amphitheaters and stadiums. And like any line of work, some of my best friends are those who I met through my employment. And I've spent, you know, months and in many cases years on the road, working long hours and living in tight quarters with these colleagues who turned to be friends. And, you know, as it was mentioned earlier, the live music industry, it's the first to close. It's going to be the last to reopen. And personally, it's been really heartbreaking to see how the pandemic has impacted the livelihoods of my friends and former coworkers. And for every one of them who's on the touring side, there are 2 or 3 local venue staff, you know, house managers and audio and lighting techs and concert promoters and ticket sellers, ushers, concessionaires, bartenders, not to mention employees at surrounding hotels and dining establishments who've been impacted as well. And, you know, it was always a great day when New Hampshire venues appeared on our tour routing, in part because I knew what it meant for our local communities, whether it was Portsmouth or Concord or Manchester, Plymouth Dairy, Guilford, Laconia, always fun to go to Meadowbrook Farm. You know, there was always a clear, direct increase in economic activity on those nights when there was a show in town. And right now, that ripple effect just doesn't exist. And so in closing, I just want to share, I was a part of an effort to save the Rex Theater, which is a movie theater turned nightclub in downtown Manchester that fell into disrepair over the years. And after rallying the Manchester community, Mayor Joyce Craig brokered a deal with the Palace Theater to renovate, reopen, and save the Rex from being paved over and turned into a parking lot. And it reopened like 15 or 16 months ago. There was a lot of fanfare, which is great because an indicator of new venues' long-term success can often be traced back to its first year of operations. However, for more than half of that time now, the Rex has been dark. And whether we're talking about the Rex or the Palace or the Shaskeen, which is a downtown restaurant with a live music room in the back, it's really critical that we do whatever we can to support these economic drivers for our communities across the state. And so I'm grateful to Senators Whitley and Perkins Coca for their hard work on the Save Our Granite Stages Act, and to Senator Prentice for including it in the omnibus package. And grateful to Senator Bradley and the rest of the committee for your consideration. Thanks.
Are there questions of Mr. Wilhelm? Yes, go ahead, Senator Whitley.
Thank you, Mr. Chair, and thank you, Representative Wilhelm, for your testimony and for being a co-sponsor as well, and all your incredible work on behalf of your constituents. So on that note, you are a leader in your caucus representing the voice of young folks. So I'm wondering if you had heard from any of your younger constituents about the importance of this industry and this sector to New Hampshire.
Thank you, Senator, for the question. I will say this, that as we were discussing as a community and really debating the future of the Rex Theater here in downtown Manchester, we heard from business leaders, specifically from the Mill Yard, which we have a lot of high-tech companies who are thinking about workforce development. They're thinking about how they attract and retain, their workers. And they said one of the things that we needed to really put increased focus on was the amenities, the arts and culture in the community, because that has a direct correlation to their ability to attract and retain their workforce. So we've, everything's shuttered right now, and that's really challenging. But the sooner we can get these venues back open, the more competitive, our local economy will be in attracting the talent that they need to be successful.
Further questions? Seeing none. Thank you very much, Matt. Griffin,
Next person I have is Doug Marino.
you're back, Mr. Marino. Thank you.
Thank you, Mr. Chairman. Thank you, members of the committee. It's great to be back at the Health and Human Services Committee. And I'm particularly excited to be testifying on Part 4 in front of some really talented musicians. My old boss, Senator Sherman, is in a band, and I understand Senator Avard as well is a very talented musician. So I'm the Advocacy and Engagement Director for 603 Forward. Our organization's aim is to educate, engage, and activate the youth of New Hampshire to take political action at the state and local level, as well as make New Hampshire a better and more equitable place for young people to live. And I'm here today to express our support for Senator Perkins Quokka and Senator Whitley's amendment to Senate Bill 132. New Hampshire has a rich cultural history, and there are many opportunities for grandstayers to appreciate arts and culture in our state. In the past, it's been estimated that there are as many as 3,500 arts-related businesses in New Hampshire, generating roughly $150 million annually in economic activity. Those estimates were made by a previous legislative study committee back in 2015, although it is very difficult to pinpoint the precise economic figures on this front. But we know that New Hampshire's cultural sector has suffered greatly during the COVID-19 pandemic. Many arts organizations and small music venues are facing serious economic hardships as they've had to close due to safety reasons during the pandemic. But Senator Whitley and Senator Perkins Quokka's amendment ensures that the Council of the Arts Declaration of Policy recognizes the critical role that these organizations play in our economy, and that they make an appropriation to make sure that these venues are supported going forward. So I thank the senators for their work on this. I urge the committee to adopt this important amendment. Artists in the Grant State need and deserve our support. Thank you so much for your consideration. Thank you, Mr. Chairman.
Are there questions of Mr. Marino? Thank you very much. Griffin.
I have Tristan Law next.
Good morning, Tristan.
Good morning, Senator. Thanks for taking my call, and thank you, Senator Whitley and Perkins Quokka, for bringing this amendment forward. My name is Tristan Law. I live in Portsmouth, New Hampshire. I've been working in the music industry for the last 15 years, and just want to underscore just what a dire position we find ourselves in. So, and while news of the vaccine is encouraging, we'll be on precarious footing moving forward. So any additional aid is going to be much appreciated. So thank you.
Love that brief testimony. Thank you. Griffin.
Next I have is Lucas Meyer.
Go ahead, Mr. Meyer.
Good morning, Chairman, members of the committee. My name is Lucas Meyer. I grew up in Concord and currently live in Ward 2, Manchester, and I'm here in support of SB 132, the Save Our Granite Stages Act. Very excited about the prospect of this bill. It was a year ago when I was at the Bank of New Hampshire Capitol Stage in Concord, a great new venue for live music, listening to the Soggy Po Boys, a New Hampshire-based band. And then before you knew it, the pandemic hit, and all this momentum in the live music industry in New Hampshire came to a screeching halt. This is a really important issue to a lot of young people. By way of disclosure, I am the chairman of 603 Forward, and through some of our early work on this bill, have heard a lot of young people in the state really excited about this. And I am here in part as an emissary for some of my friends who are in the music industry who could not be here today. Some estimates show that the recovery for the live music industry will be 3 to 4 years until they're recovered. So meaningful investment and leadership from the state can really go a long way in supporting this key industry. Stay Work Play released a study maybe a year or two ago where they polled a number of young people across the state about issues most important to them and what's keeping them in the state or what's pushing them away from the state. And surprisingly, or perhaps unsurprisingly, if you grew up here in the state like me, a number of young people pointed to loneliness as one of their top concerns in the state. Having a really robust live music industry and arts and culture industry can help make those connections after this pandemic for young people to feel invested in their community, and also to highlight some of the incredible musicians we have in this state. I grew up in Concord, and I grew up knowing Commissioner Van McLeod as Mr. McLeod. I actually spoke with his wife and his daughter yesterday, who were very excited about this bill, and I believe they both have signed in support of it. So I'm really hoping that, as the commissioner used to say, onward and upward, and I hope that this committee can work together to find a way to meaningfully invest in our arts and culture industry. The commissioner did amazing amount of work in his lifetime building the arts and culture in the state. And I think we have a real opportunity here to lead and to make sure our musicians and our independent venues know that the state of New Hampshire has their back and they're paying attention. And I will keep it brief, and I very much appreciate everyone's work on this bill. Thank you.
Senator Whitley.
Thank you, Mr. Chair, and thank you for your testimony, Lucas. As an emissary for your musician friends and for young folks in New Hampshire, are you aware of, the significant workforce shortages we have in New Hampshire? And do you think that, bills like this, sending a message from the legislature, will do anything to attract new folks to New Hampshire and keep the young folks we have to address the workforce shortage?
Absolutely. I think when you look at sort of the pie of which makes someone, stay in New Hampshire or come to New Hampshire, having the options for live music is really important, especially where we find ourselves regionally. I mean, we are in between Portland, Burlington, and Boston, which have some of the biggest acts traveling into their towns and those cities. There's no reason why New Hampshire can't become one of the premier live music states in the country based on our location alone. So, on the conversations I've been having, people are really excited about this. And from my perspective, it's really important that we get new young people involved in the process. And what we're seeing through our advocacy is folks who haven't testified on a bill before or haven't seen state government working for them. They're really excited at this prospect. Not to speak for Tristan, but I think this might be one of the first time he's testified on a bill before. So I think this is really exciting and an opportunity, again, to show leadership from the state level and carry on some of the great work Commissioner McLeod started in 1992, I think.
Thank you.
Further questions? Seeing none. Thank you very much.
Thank you.
Last person I have is Polana Belkin. Hope I'm saying that correctly.
You nailed it.
Good morning.
Good morning. I will be very brief. So the arts are something that's very central to my life. I am a Rochester resident. I am a performer. I perform music. For 2 years, I hosted a regular open mic that was kind of an omni-genre thing where we had dancers, we had musicians. It was definitely an all ages thing. There were kids, there were people, in their 60s and 70s. And I also hosted a comedy open mic, Sue's Space in Rollinsford. Sue's was a very small art venue located in the Rollinsford Mill, and now it is closed. It was a one-of-a-kind venue, but it was very much a month-to-month operation, and 3 months of no revenue coming in, and they were forced to close over the previous summer. I am also a fan of music. So when I moved to New Hampshire, I moved from Boston, and I assumed that all of the access that I had to these dozens of intimate music venues, things that were 30-minute rides down, or rides on a bike or hop on the T, and that has not been the case. I've seen tours skip Boston to come to Portsmouth. I've had friends from Pennsylvania come up to stay the weekend with me. And obviously we go out to eat for every meal. It's a great economic boost. I found my own local favorites, but then I've also seen some of my favorite national acts come through here. And that's something that's very important to me. All of this progress has been super recent, and it's very delicate. It's been the result of a lot of years of hard work to get to this place where Portsmouth is, pulling in acts over Portland or Boston. Finally, a hat that I wear is I'm a Rochester City Councilor alongside Senator Gray. I am on the Arts and Culture Subcommittee. And in Rochester, we have so many great small venues. We have the Performing Arts Center, we have the Opera House. Yearly, there is a Porch Fest event where there are dozens of bands playing at the same time outside. We have the Governor's Inn and the Garage, but we also lost a comedy venue this year that could not find a way to stay open in the pandemic. And these are, very valuable to me. And I know so many other young folks. It's really, a great place to come together over culture. So that being said, please support part 4 of this. Thank you very much.
Thank you very much. I don't think there are any further hands. Senator Sherman.
Thank you, Mr. Chair. If it's okay with you, I would very briefly like to testify on this bill as a whole. Is that possible since I'm co-sponsor?
You know what I'd suggest? I'm going to have some suggestions in exec session, and I think we can discuss that there. Is that all right?
Yeah, I just wanted to be on the record that I think that this bill addresses many critical concerns. And I will say one sentence if I could, which is many of us felt that there was both devastation and also some opportunity coming out of COVID. The only way we're going to come out of COVID stronger is to really support all of the areas of the economy and of the state that have been devastated by COVID. And I think this bill really touches on many of those. So I just wanted to vocalize my strong support for each component of the bill. And thank you for that.
Okay, Senator Whitley.
Thank you, Mr. Chair. I also want to echo that strong support. This is a package that's going to, support the health and economic well-being of the state. I wonder if, for the record, Griffin or the chair could read the numbers of folks who signed in support of this bill.
Yeah, Griffin, go ahead. I have no idea.
Yep, hold on.
That's normally in a hearing report, so it is a matter of public record.
Give me a second here. Oh, okay. Forgive me, but there does not seem to be an assigned number like there used to be. I could certainly count them, and I could mention it in exec session if you just give me time to count them.
All right, why don't we do that, and it'll Kirsten can make sure that is reflected in the hearing report. Okay. All right, so I'm going to close the hearing on Senate Bill 132 and entertain a motion to go into executive session.
So moved.
Senator Sherman has moved, seconded by Senator Avard. Okay, I'll call the roll. Senator Sherman?
Yes.
Senator Gray?
Yes.
Senator Whitley?
Yes.
Senator Avard?
Yes.
And I vote yes too. Okay, so we are in executive session. So let's discuss 132 first, if that's all right. Here would be my suggestions. As I think I already indicated, we have two pieces of legislation that deal with COVID-19 testing. Senator Sherman's bill that we heard prior and part 1 of 132. I think it would make sense to remove part 1 of 132 and focus on Senator Sherman's bill 123 for COVID testing. my own personal view is if there are gaps in coverage, or if a gap in coverage will exist when the New Hampshire emergency order is over, then I think I'd be willing to look at how we should address that with legislation. I haven't seen the gap yet, but I am open-minded to it. I would ask Senator Sherman, you and Senator Prentice to work with the carriers and the department to, try to define that and come in with a reasonable package. Does that make sense?
Yeah, to some extent. I would want to talk to Senator Prentice about pulling her section out completely out of this bill before, I would agree to doing that. But I think it's reasonable to go back and combine the efforts. I do believe the gaps exist, and I think there will certainly be a gap once the declaration is lifted. So I'm happy to run that group, and I've actually already asked Jenny to pull together that group to have that discussion.
Senator Woodley?
So just very preliminary conversations with Senator Prentice. I think she is very open to pulling part 1 out of 132 and working with, I'm sorry.
Yeah, no, that's right.
Correct. And working with Senator Sherman to put it on his bill. So preliminary conversations with her, she is open to that.
Okay. On part 2, it would be my recommendation that we, especially since we heard no opposition, and I've long supported the RDCs, I am happy to work with Senator Prentice because I think we should, do, if this is going to be exclusively federal funds, which I believe it will need to be if we're going to go forward with this, to raise the $1 million limit to something higher, to raise the $10,000 limit to something higher, and raise the 5 or fewer employees. And then we would potentially pass that and make a recommendation to the Finance Committee, because that's where it would go next.
I just have a quick question on this. I have at least 2 small businesses in my district that fell between the cracks. And I believe Senator Prentice believes that they would potentially be beneficiaries of this. They both started before the declaration, but they didn't have a full year of records to show for PPP Main Street or GAP funding. So they had no assistance all the way through, and they're still squeaking. Would that, is it your?
I'd be happy to add something that would target businesses that, for consideration by the RDCs that had not gotten PPP, Main Street, or potentially any, further federal PPP or Main Street. I think that makes sense.
That'd be great.
Okay. Part 3, I think, is a good idea. I'm okay with the way that Senator Rosenwald has said federal funds as hoped for, but with the possibility of a general fund expenditure. I mean, I think that this is something that needs to be done. We need to work with the department on the confidentiality issue. I don't know if Senator Rosenwald is still on the phone, but I think she could do that as the sponsor of the bill. And Griffin, you could ask her to do that. And it would be my recommendation that we move the August 1 date back to November 1.
Senator Bradley?
Yes.
Could I just make a comment? I am a co-founder of the senior support team. We've worked since April to support. We currently have 54 of these facilities in our network, supporting them with volunteer support. And a couple of comments. The first one is that I think this is critical. The second one is I would encourage it to be supportive and not putative, really looking at how can we help these facilities really achieve the goal of safety and understand where they needed help and make sure that those gaps are closed. So I'm in 100% support of this. I think it's absolutely critical in it. And the sooner we get started, I'm okay with the November start, but the sooner we get started on this process, the better, so we can actually make those changes as quickly as possible.
Yeah, and look, my by moving section 1 into your bill, Senator Sherman, my hope is that we're able to exec this bill next week.
Okay. Good.
Okay. And lastly, I think part 4, again, sort of the same criteria, federal funds, great idea. There's no question that, venues have been more impacted than just about anything. I think that the one question I would have of you, Senator Whitley, I'm not sure why you would strike in your amendment the reporting request.
That was requested by the Council for the Arts. And so if Ginny or Commissioner Stewart is on, they can speak to that.
Well, it would be my suggestion that we bring that back in an amendment. Other than that, I thought that was good to go.
Okay, I will work with them on that.
Senator Gray, Senator Avard, any thoughts on parts 2, 3, and 4?
I think you hit
Senator
it.
Gray.
Okay.
I guess part 3 is my sticking point right now, dealing with the confidentiality and the department. Certainly, if we are going to try to exec that, I need the department to work with whomever on that portion of it, so that it does not create a conflict and a problem there.
You are deputized to work with Senator Rosenwald in the department.
Again,
you'll learn never to open your mouth again.
Again, Senator, I think that there is a prime sponsor of that bill, and if they want to gain my vote on that portion of the bill, I think that they should take the responsibility for that.
All right. So Griffin, would you ask that Senator Rosenwald make sure to work with Senator Gray on part 3?
Yeah, Senator Rosenwald is on the call. She's in the attendees list, so I'm
All right,
assuming.
why don't you bring her on?
All right.
Senator Rosenwald, are you there?
You're muted.
She might have maybe stepped away. I'm asking her to unmute.
I'm here. Sorry. Sorry, I stepped away, but I'm back. What were you asking me, Senator?
Yes, Senator Gray just wanted to make sure that we have worked appropriately on the confidentiality with the department. And I just want to make sure that you work with Senator Gray on that amendment with Ms. St. Cyr. That's it.
So my notes that I took are you would like the report pushed back to November 1st. And when I'm thinking, and I was going to run it by Melissa St. Cyr, but since Senator Gray is before us, what we might want to add is to the extent allowed by federal law, something along those lines.
Yeah, exactly. So, but if you work with Ms. St. Cyr and Senator Gray, and if you feel you need to have an interim report, I suppose you could do that too, although the difference between August 1st and November 1st is.
Yeah, no, I'm okay. I'm okay
Okay.
with November 1st. I had, as I said, I thought about asking the committee to do that, but didn't because this bill supposedly is going to be fast tracked. But I think it's okay, especially since the appropriation actually won't be available until July.
Okay,
Thank you. And
Yep.
thank you for your support.
okay. And I guess we're to any other discussion on the way I envision parts 2, 3, and 4 going from either anybody on the committee. Everybody, at least for today, okay with where this seems to be heading?
Yes, thank you.
Okay, so let's go to the list of the bills that we have. Griffin, was there an update on Senate Bill 29, high concentration marijuana in alternative treatment centers?
There we go. Unmute myself. I apologize. I don't have any update from Senator Guy on Senate Bill 29. I know he brought it to the board and had a discussion there. I apologize. I didn't follow up with him as to what was the outcome of that meeting. So I will check with him after this meeting.
Okay, so we'll hold on that one. Senate Bill 74, I did speak with, I'm sorry, Senate Bill 74 is Senator Sherman's bill. And I know that you're making progress, but you're not there.
This is the end of life decision-making.
Yes.
Yeah, we've had, at this point, we've had 4 hours of meetings. We are very close. I don't think we're going to have everybody completely happy. But as Senator Bradley has said many times, that means it's a good compromise. My expectation is that I'm targeting being able to exec this. Do we have to do an exec next week to have it on the March calendar? What's our deadline?
If to have it on the first day in March, yes. It doesn't have a fiscal note, so we have a little bit more time.
So if my target to have an amendment before the exec session would be the first week of March, that would be potentially okay with this committee?
Yes, I see no reason why that wouldn't work.
Okay. I think we'll be there.
Okay. So I spoke with Senator Prentice last night on Senate Bill 75. She asked that it be held for another week, so that's not a problem. Okay, so moving right down the list. Senate Bill 97. Senator Sherman and I have been working on an amendment. Griffin, you should have it.
I did email it out to the committee members today on their legislative emails. I'm pretty confident I threw it. Kirsten, is it in the OneDrive? I think
On
it is.
the
Yep.
Yes, it is in the OneDrive.
Yep, I'll share it 1 second.
Do you want me to give a brief overview or?
Yeah, go ahead. Go ahead, Tom.
So essentially what this amendment does is it answers the concerns of carriers and the department. Since this is a fairly unknown entity, and the impact is unclear, the amendment would limit the direct primary care providers who would qualify under this to 10. It would sunset in 5 years. Correct me if I'm wrong on any of this, Mr. Chair.
No, I think you're right.
And then it would have, the DOI would have a report at the end of this reporting on the impact of this pilot study of direct primary care. So I think it allows them to move forward. But it does provide some accountability depending on the impact. If the impact is minimal, nominal, or not at all, my suspicion is this would be allowed to continue or it would be reauthorized and broadened. But since it's an unknown, I think this is a really good compromise to allow the generation and analysis of data to see whether this really is having a significant upward cost factor on policyholders and the carriers.
So again, I think this is a good compromise. As Senator Sherman said, I think there was a lot of support for it within the committee because of the, I think Senator Avard nailed it best. It offers some competition, but the carriers had a lot of questions about it. So limiting it to 10, sunsetting it after 5 years with a reporting requirement makes sense to me. And I think the 5 physicians that are already doing this would be covered under that limit of 10.
Was there another amendment that was going to be presented on this by Curtis Berry? Or?
Yeah, so that's part 2.
Right.
It should be on the screen right now.
Yep. All right.
Oh.
So,
so I had to scroll down.
There it is.
Yeah, no. Griffin does the scrolling for us here. Okay, so if you recall at the hearing, I asked all the.
I just had a question before we move on to the second part. Can I ask a question?
Go ahead. I'm sorry.
Thank you. Just so I understand the sunset is at 5 years. I don't know if there was any discussion with the stakeholders having a 3 versus 5 year sunset. Was the 3 years not enough to actually sort of study it?
Well, I think 3 years would not be enough to gather enough data to be able to analyze it. And with the 10 person or the 10 practice limit on it, it really, if there is a negative impact, it would certainly limit the extent of that impact by having the number of practices limited at 10.
Okay, thanks.
You okay, Senator Whitley? Okay. So on the second part, as you recall, this dealt with
Senator Bradley. Jim's trying to talk.
This is I guess I haven't gone through this whole thing, but setting a limit on the practices to 10 doesn't seem like a good compromise to me. If this is a model that should be used throughout the state, then we would be limiting people to a substandard method of healthcare if this is better. Again, it's a choice that people are making, and I don't know that a limited 10 practices is really where I want to go in this.
Well, let me just say this, that based on what I would call significant and pretty much universal opposition by the carriers to this, there's also a consideration on my part, and I think Senator Sherman's part, of how do we get something passed? And while I think there's support amongst the 5 of us, once it leaves this committee, it becomes more difficult to get it passed without the limitations of the 5 years and the number. So I think, at least on my point of view, Senator Gray, that's where I came down on to try to get something passed with that limitation.
Senator Bradley, if I could just jump in, we're not limiting the number of direct primary care practices in the state of New Hampshire. We are only limiting this part of the practice where what this was trying to do was to stop the carriers from requiring that one of their in-network providers write the order. So direct primary care could continue to expand, but only 10 practices would have this particular component of their practice. They would only 10 would be able to participate in this, but it would not limit the number of practices across the state. And 10 was picked because this concept is not brand new. And right now, there are only 5. So it allows 100% growth in the over the next 5 years in participation in this pilot. So I don't think it's anti-competitive as much as it's more of a beta test.
Senator Gray.
Go ahead.
And in actuality, what you're creating is 2 different classes. Is that doctors that find this to their advantage, that first 10 can be the ones that can make these referrals. But after that, no, you can't. You're not part of that class. And again, I think that the concept is fine, but this isn't the right solution. So, you know, I would find it hard to support the amendment the way it is with those restrictions.
Then what would you suggest?
I have no idea. It's been Senator Sherman who has been spearheading this one. You know, I've been out busy working on election law issues, as Senator Bradley knows. And I don't know what the solution is.
Well, Senator Gray, that, you know, this was an attempt to respond to the department and to the carriers' concerns. I agree with you. I would prefer that there were no limits. So somewhere in between all of this, we have the passability of a bill that, and, you know, so I've sort of deferred to Senator Bradley on what he thinks might be able to make it through. Representative Marsh, who was chair of the committee that I was served on looking at direct primary care, is actually the one who put together the language on this after our meetings. And he's comfortable as a physician and as someone who's worked very closely with direct primary care, as is the Medical Society, on this compromise. So, you know, I would love to have your support, understanding that all of the participating physicians support this language as a compromise. But if not, my worry, as is Senator Bradley's worry, is that if we get rid of the 10 physician or 10 practice limit, we will move from something that to something that will not have the support of the department.
Yeah, and runs into problem in the House. I mean,
Senator Everard has his hand up. Senator Bradley.
I'm sorry. Go ahead.
Thank you, Senator. Well, I'm kind of, you know, just piggybacking on Senator Gray's. I mean, I like the idea of the 5-year sunset, but I can see where as soon as you limit it to 10, that some of my colleagues in the House are going to say, well, who picks the other 5? Are we going to be picking winners and losers? And I can already see that coming. And I think it might please department heads with this compromise, but just my gut feeling when it goes to the House, that's going to be one of their first questions is, well, you know, who's going to be picking these? Who's going to qualify? You know, will there be some fake startups? There's just a whole number of questions. I mean, so limiting it does to 10. I mean, that kind of rubbed me the same way. I'd like to see it unlimited myself, to be honest with you. It goes in the spirit of competition. I know that's not what the department heads are going to like, but they're not the ones voting on this.
This is Jim again. One of the things that we talked about during the hearing was some kind of a review procedure from the carrier of the orders that the doctor, you know, the referral that they would make. That's certainly one thing that I haven't heard discussed again. The other things is there could be some agreement between the people who are doing primary care and the carriers. Again, I think that there's a lot of different things that are out there that could be discussed and could provide solutions to this. But limiting it to 10 may be the easiest way out and most efficient, but it may not be the best for the consumer, may not be the best for this idea going forward.
Well, does somebody want to propose an alternative number than 10?
I like it to be open, just for.
I think Senator Avard, while I understand where you're coming from, even with a 5-year sunset, which limits it in the other direction, we're going to have universal opposition from the insurance carriers. And I think they raised a number of questions, as did the department. So that's why Senator Sherman and I tried to self-limit it so that it was a pilot program. And if it works well, I think to Senator Gray's point, there's nothing that in that 5-year period doesn't preclude another piece of legislation, either extending the deadline or increasing the limit, whatever may be established.
How do we avoid the perception that the government's going to be picking winners and losers on this?
Well, I don't.
Who qualifies? I mean, who, is it the first?
The first 10 would qualify, and we know there are 5 out there. So think about all the general practitioners in the state of New Hampshire. There are only a handful that are wanting to do this right now. So I think we're expanding that, and it can be looked at in the future.
The other reality is that if this passed the Senate in its current form and went to the House, they could presumably pull that limit. And then it would be up to us whether to concur or not. Certainly, I'm fine with no limit. So if the House elected to pull a limit and amend this to get rid of that limit, Senator Avard, when it came back for concurrence, I'd say fine. I think I'm in alignment with you. I just want to see at least the current 5 and another group have the ability to do what I think is, you and I are in the same boat on here. It's a bit anti-competitive not to allow these primary care docs, direct primary care docs to order their own labs.
I'll go with that. I'll go with that. If they agree to open it up, and that'll be fine. Good, let's do it. Section 2.
Okay, moving right along. Okay, so if you recall at the hearing, there was testimony from Curtis Berry about being supportive, but with some small changes. So Mr. Berry worked, and he represents one of the PBMs. He worked with Rick Newman of the New Hampshire Pharmacy Association and Dave Rochefort, who is the pharmacist that testified in favor of Senator Hennessy's bill. The amendment does a couple of things. It adds language that any mail or delivery service is ancillary as opposed to primary to a business's delivery service. It also adds language that the retail pharmacy, if they engage in mail or delivery, provide a disclosure of surcharges and that it may not be reimbursable, and also adds language regarding the retail pharmacy obtaining confirmation of delivery to the patient. And Senator Hennessy has been in touch with me. It sounds like all of the parties that we tasked with coming up with a compromise have done so, and it's reflected in this amendment, part 2.
Look good to me.
Yep, me too.
Okay. Does somebody want to move the amendment, which, Griffin, you got to scroll to the top. I don't know what the number is. 303.
I'll move SB 97, 2021-0303S.
Okay, is there a second?
I'll second.
Is there further discussion? Okay, let's call the roll. Senator Gray,
No.
Senator Avard,
Yes.
Senator Sherman,
Yes.
Senator Whitley,
Yes.
and I vote yes. All right, is there a motion of ought to pass as amended?
So moved.
Seconded by Senator Whitley. So let's call the roll again. Senator Whitley,
Yes.
Senator Sherman,
Yes.
Senator Avard,
Yes.
Senator Gray,
No.
and I vote yes. Okay, so I think Senator Sherman, you get to do the honors on this one.
Oh, I'm so
And
excited. Thank
obviously
you
it
for
will
that
not go on
opportunity.
consent. All right, I'm looking through the cheat sheet. Okay, so we, do you want to, let's discuss Senate Bill 121. That was the one we heard this morning, Senator Rosenwald's bill on the state-based exchange.
I like Jim's idea of holding it back. If we can do that and see what the department will come up with what time limits, constraints that they have, rather than maybe sending it to study. But that's my opinion.
All right, so what about the option that I suggested, that we pass it, but that we strip the sentence on line 7 of the bill, if in the department's opinion, and substitute it for the department shall report its findings to the governor, Senate President, House Speaker by November 1, 2021. That,
Griffin, can you make that bigger?
Yep.
Yeah, all of a sudden now it won't pop up on my screen.
Good enough now?
Yeah, zoomed for the 63-year-old. Thank you.
And for some reason, Griff, just for the record, it doesn't, the PDF doesn't work again.
Come on. Okay, we'll work on that
What are
one.
you doing over there? I'm kidding. You're
No,
doing, you're doing a great
you
job.
must be using the state-based laptop.
Yeah.
Senator Bradley, what are you proposing to strike?
On line 7, the last sentence, if in the department's opinion, and the rest of it, strike it, okay? That's what authorizes the state-based exchange based on their recommendation. I'm a little reluctant to give, even if we added fiscal committee review, I mean, normally they're, budgetary items as opposed to policy items. I think the Joint Health Care Reform Oversight Committee, I've served on it in the past. I think there are only 6 members. I think that is a very small subset of the legislature to be making such a big decision. What I'd prefer to do is, if this is a good idea, let's bless it and bless the research that the department would do, which DJ said that they're more than willing to do, but I don't think we can get credible information in 6 weeks, quite frankly. And I'd rather pass it, and with the suggestion that I made, the department shall report its findings to the governor, Senate President, and House Speaker by November 1, 2021. So assuming the House were to pass it, they would have several months to research it, other states, even put out, requests for information, potentially from vendors to do it. I think that would move the ball further and faster than anything else.
So
Senator Bradley, if we did that, could we do an effective date upon passage?
Yeah, that would be fine. That's a good idea.
This is
Senator
Jim.
Gray.
The reason for the 6 weeks crossover is what, the 1st of April, and our actions would have to be taken by the 24th of March. To push this through right now without even giving the department a chance to go see what they can do in those 6 weeks, I believe is ill-advised. I believe that if we're going to implement this, that it needs to get through the legislature by the end of June so that the governor can sign it and that we could implement this as soon as we could, which would be sooner than what you were suggesting, the way you would handle it. The 6 weeks right now will not affect this bill in the least. It will go over to the House and crossover. And I believe that waiting those 6 weeks is a prudent thing to do.
may I ask a question?
Yeah, Senator Sherman.
So I'm just a little confused. Jim, when you're saying implement this, are you saying that in the next 6 weeks, we would ask the insurance company, the Department of Insurance to essentially do lines 3 through 7 and let us know if we should implement this and then turn this bill into enabling legislation that would allow, or into allowing us to go ahead and implement it? Or are we, I think Senator Bradley's would end up with a report on which we could then file legislation next session, which would mean that this implementation would not be done until potentially June of 2023. So is that what you're saying, Senator Gray, or?
I am saying that they should do as much as they can in those lines in investigating this to see if it is. They may discover a fatal flaw. They may discover, something. They may not get all of the information done by the 6 weeks from now, but we will have additional information on which to go forward. The best scenario would be, hey, it's the best thing since sliced cheese, and I changed that from bread just to make it interesting, and give us the ability, and yes, be able to modify this so that they would, it would be a bill to go forward. The rest of the information could be gained for the House during the time that it is waiting for its hearing over there, and this thing could move forward.
I think the only problem was that we heard from the DOI that current law, that they would, there is an argument to be made that they're even prohibited from doing that under current law.
Well, I think that under current law, research was not covered. I think, as I recall, it said planning, implementation. Somebody read it out, but I think it, look, if we want to hold for a few weeks and ask the department to do this, I don't think we've lost anything. I question whether they can get a good answer to us, given how much, pressure is being put on the department with, all the legislation that they have to respond to. But if we want to wait, I don't have a problem with that either.
I agree with Jim. I think that's a smart move. Because if they find out this would be significantly cost saving for the state, we don't want to wait all the way till June 2023 to implement it. We could have it done in June 2022. What is this, 2021? Sorry, I'm getting my 2020s mixed up.
Right. I want to be sensitive to the fact this is a, it would be a significant change. We would want to have a lot of support for it if necessary. I just want to make sure that we have the appropriate amount of information. They have the appropriate amount of time to do the study.
Yeah, and I would just say, I'm not going to be very supportive of moving in this direction unless there is significantly more oversight and approval by the entire legislature than just, the Joint Healthcare Reform Oversight Committee. And when I was thinking about the fiscal committee, it was just a thought that I had to expand that. But the more I've thought about it, I think Senator Whitley's right. It's a big, big change, and it really needs a lot of homework done. But if we want to wait, that's fine.
Good.
So Joe, I'm sorry, just to be clear, no amendment right now. We're just holding on to the bill.
We'll just hold on to the bill.
Right.
Is somebody going to talk
believe-
to the department and let them know our expectation?
Yeah, Griffin, could you reach out to DJ and sort of give a heads up on this discussion?
Yep.
All right, we already took action on Senator Sherman's Bill 120. We discussed 123 and 132. So I think we're good to go on everything that we have. Griffin will update us on Senate Bill 29 for next week. So Kirsten has told me that we have a number of bills likely for next week. Everybody okay with 8:30?
Yes.
Okay. Great.
Motion to move out of exec.
Could we have a motion to come out of executive session?
Motion to move out of exec.
Seconded.
Okay, so the motion was made by Senator Avard, seconded by Senator Whitley. All in favor, Senator Avard,
Yes.
Senator Whitley,
Yes.
Senator Gray,
Yes.
Senator Sherman,
Yes.
and I vote yes. And now a motion to adjourn.
So moved.
Second.
All right, so it's been moved by Senator Sherman, seconded by, who was it?
Actually, I think it was moved by Senator Avard and seconded
Moved by
me.
Avard, seconded by Sherman. Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Whitley,
Yes.
and Senator Sherman.
Yes.
Okay, so we'll see everybody tomorrow, but obviously next Wednesday, at 8:30.
All right.
Great,
Thank
thank
you.
you all.